Okay, good morning, everyone. We're going to start slowly. Today we're going to do actually practical part. Practical as in like doing case studies. So we're going to try to compile everything so far that we covered. So I prepared a couple things for you. Our sort of meeting today will have a few parts. First one, we're going to talk a little bit about TCM case studies. So how to create diagnosis. So we're going to just review it. It's about 3-4 pages. That just leads you quickly through why we diagnose, how we diagnose, and how should that work for. Sorry, you okay there? All right. A little yoga in the morning, right? And then second part's going to consist of 8 case studies that we're going to do it together. So we'll actually look at case study, and then you'll see the answers like immediately after it, right? So we can do them together, just to sort of warm you up. And then the third part's going to be consisting of 16 case studies. They're all printed for you on a paper. And on the first page, you're going to have all the information, kind of like an exam. And then we're going to give you 15 minutes on a second paper to create diagnosis. That means illness, syndrome, and the treatment. So we'll have 16 of these. Each one's going to be about 15 minutes or more if you need to. So we'll. So, do I have a USB? Yeah. I'm actually using this right. Okay. Okay. Here we go. Yeah. So we'll sort of start with review. We'll do a few case studies, and then we'll end up with actually doing the real case studies. Most of these case studies are used from the books like Machiocci and others. They are used for the bank of the questions that CTCM PAO, well, we know that they use it, or they actually put it as a reference. So let's start with the TCM case studies. So I'm going to just move this a little bit. Okay, so in terms of a case studies, we sort of follow certain steps. So the college hired a third-party agency that will administer case studies to you. Okay, so it's going to be there. Okay, not a problem. So they're going to administer. You will have main medical complaint or chief complaint, right? You'll have a bit of a health history on a patient, so it's not going to be elaborate, but it'll be enough for you to sort of get a sense of what's going on. And in that terms, it'll be split in symptoms described by patients, so subjective, basically disclosure of information, and then there'll be objective information or information collected by you or practitioner that'll be given to you. And most commonly, you'll have 2 groups of this information. So there'll be some signs and symptoms, and then there'll be a pulse and a tongue that supposedly you observed on a patient. And then based on these, they will want you to do a couple other things. Okay, so they'll want you to create first a TCM diagnosis, and we know that TCM diagnosis has 2 parts. One is TCM illness, and another one is syndrome differentiation. So we know that TCM illnesses are not quite the same as biomedical illnesses or diseases. So here, illness, disease, disorder are 3 interchangeable words, but the college prefers the illness. So for example, in TCM illnesses, you can get cough. We know that cough is not an illness or disease in biomedicine. So lots of people may or may not be confused by this. So the TCM differs because cough is observed as showing up in so many other pathological illnesses, right? And it warrants the category of illness of its own. So in Chinese medicine, for example, cough is disease. You may get something like one of the upper respiratory disorders, like let's say pneumonia or flu. And we know that in biomedicine, those are indeed illnesses. So be careful when you get or design the illness what you think is or patient has, because he may not follow quite the biomedical sort of definition of the illnesses. Under the syndrome, you'll be doing a syndrome or syndromes. That means one or two or more if you think there's more there. And these will be describing the particular presentation of illness on that particular encounter. For you, that encounter is exam. So the syndromes are particular presentation of the illness, and we treat according to that particular presentation, so to particular syndromes. There's also another name we use for syndromes. Sometimes we call them patterns of disharmony. So syndromes and patterns of disharmony are interchangeable, just so you know. Once you define the syndromes, then there'll be a next step where you're going to define the treatment principles based on what you just did. So for example, if you had a flu as an illness and syndrome differentiation is something like a wind cold invading the lungs, then your treatment principle will be something along the line of removing the wind cold, reducing the presentation of the flu, right? And then in treatment plan, you will decide what kind of treatment modalities you're going to be using. For most of you who are acupuncturists, obviously you'll be using acupuncture, maybe Chinese manual therapies like Tuina, some other associated therapies like microacupuncture systems such as ear, scalp, wrist and ankle, or any other microsystem. Even maybe other modalities like cupping, moxibustion, bloodletting, right? And of course, you're going to be defining it how you're going to use those modalities. And for TCM practitioners, they're going to also add the herbal portion of it, where they're going to define the formula they will be using it. And then in the third part, you may need to add some, if you will, and if you have time, some lifestyle counseling on nutrition, on sleep hygiene, on exercise, mental disposition, and so on and so on and so on. So in acupuncture and herbology, you will be adding the frequency of the treatment and the dosing, for example. So if it's acupuncture, you may say something like treatment will be occurring every second day for 3 weeks, and then we will reassess the patient. If it's herbal part as well, that may be actually a dose of the, let's say you just prescribe Xiaoyao San, Bupleurum Dangwei formula. You'll be basically putting how much you're prescribing in grams and how often, 3 times, so let's say 3 grams 3 times a day after meal for 7 days, right? So there'll be a frequency and the dosing per day and the duration per period of the prescription of the medication, right? So these are the basic sort of parts of the case study that you will be tackling. So let's look some other parts, particularly addressing the chief complaint first, because that's going to be the first thing you see after demographics. It'll be like something like 45-year-old male, and then there'll be a chief complaint. And chief complaint could be a cough, for example, that lasts 3 weeks, right? So basically, when we looked at chief complaint, we got to look at the sort of what's the cause of chief complaint, like what is really behind the chief complaint. We got to separate the timeline. So your diagnosis is always for the patient that's present at that time. So just because we give you information, or they give you information that cough lasted for 3 weeks, you can also look for present information. What's going on right now at an encounter? Of course, you're going to acknowledge the 3 weeks of the cough, but you also wanted to know what is it going on now with the patient, right? And that may bring you to the sort of like a level of the pathology that's happening presently with the patient. In terms of illness, what is the appropriate illness for the chief complaint? So you have to decide what else is going on. For example, let's stay with the cough. If the chief complaint of the patient is a cough, sneezing, runny nose, and sore throat, does this patient have a cough as an illness, or does it have a cold or a flu as an illness? Right? So you'll need to differentiate the illnesses here, right? If the patient just have a cough, with probably not many signs and symptoms following any other upper respiratory disorder, most likely we're talking about cough as an illness. But if the patient in this case has a cough plus other signs and symptoms, they are following most common upper respiratory disorder like a flu or a cold, most likely the illness is not a cough, but a flu or a cold. And then we'll decide between flu and cold depending on severity. So can someone tell me what's the difference between flu and cold in terms of signs and symptoms? So both have, for example, cough, I'm guessing, right? Both have runny nose. Both have maybe sore throat. Both maybe have a thirst. And then what else is there? What would the flu have that cold, for example, wouldn't have? Yes and no. Cold can have a fever, same as flu. Not necessarily. They could have a wind cold and wind heat. So when we're defining the flu versus cold, you have to understand that the flu is cold on steroids in a sense, pathophysiologically, right? So the flu will have some more systemic presentations that cold may not have. For example, flu may have overall body soreness, like you feel like truck went over you, not once but twice, right? So the patient will complain that they're very fatigued, they can barely move. That means that the viral load is much stronger than per your regular cold, be it from wind cold or wind heat pathogens or wind dryness. In flu, you're much more, you have malaise and you're deconditioned, right? And that's one of the common things that we differentiate. That patient is very tired. They cannot move much. They have this overwhelming body pain all over them, right? With the flu, yeah, not so much with the cold, right? So there's more of systemic presentation in a flu versus the cold, because of the congestion of the viral load as per square tissue, like in your blood and other tissues, right? So that would be, for example, differentiation between flu and cold, right? So based on this, what's presented to you for chief symptom, you would need to differentiate sometimes which of the illnesses it is. And they may give you illnesses that are very close to each other, like flu and cold. And then based on severity, you'll need to decide, is it really just a cold, which is just a common upper respiratory disorder, or is it like a flu that's much stronger and patient is very debilitated by it? Okay? Then when we look at the patterns, we may have a pattern or a syndrome, so it's interchangeable word here, and we may have a primary pattern or syndrome and secondary pattern or syndrome. And the difference is the primary pattern or syndrome is usually directly related to the chief complaint, right? So you need to sort of identify as much of chief complaint, subjective and objective data that patient gave you and that you're observing it, and that most likely would be that primary syndrome or pattern. Most likely you're not going to be able to pile everything under that syndrome or pattern, but about 3/4 of it will point you to the right pattern or syndrome, right? Secondary pattern or syndrome is usually an extra syndrome or pattern that fits on all other signs and symptoms that are not explained by the first one, right? So you may have things like, let's say, let's stay with the cold. So the patient comes with cough, sneezing, runny nose, tongue is pale, with thin white coating, no sore throat, more like chills and fevers, right? So you're like, oh, okay, that looks more like a wind cold. He has a few elements on wind heat, but it's definitely not wind heat because, according to tongue, it looks like wind cold because it doesn't have sore throat. And the patient is, for example, I'm just making it up, reporting the more of the occipital headache, which is usually for wind cold, versus the frontal headache that it's a wind heat, right? So you're like, okay, so the primary pattern or syndrome is for sure wind cold invading the lungs. But then you also notice the patient is very pale. Patient is reporting spots in front of the eyes, um, sort of low appetite. Patient also reports that like it's stuck emotionally in sort of like a depressive thoughts. So you're like, okay, so that's definitely not wind cold. So because we have these other signs and symptoms, most likely we have a secondary pattern, and that secondary pattern may be something like maybe a liver blood deficiency with the spleen Qi deficiency, right? So then your primary pattern would be acute presentation of the patient, which is a wind cold invading the lungs. Your illness would be a cold, right? But the patient only had pre-existing conditions that point to some kind of spleen Qi and liver blood deficiency. So basically, your diagnosis will read something like this. Illness, cold. Primary pattern, wind cold invading the lungs. Secondary to spleen Qi deficiency and liver blood deficiency secondary syndrome. So then treatment principles would be what? So we have cold as an illness. We have wind cold invading the lungs. We have spleen Qi deficiency and liver blood deficiency. So what we do is we flip the treatment principles, right? So treatment principles would be something like venting or removing the wind cold from exterior because it's embedded in your superficial tissue, right? So removing the wind cold from exterior. And then acknowledging the secondary pattern, which is like tonifying spleen Qi and liver blood deficiency, right? And lastly, treating the cold. So venting or exterior from the wind cold, tonifying spleen Qi deficiency, liver blood deficiency, and addressing or treating the cold. So that will be roughly a treatment principle based on what you define in diagnosis. Okay, so another issue I want to just touch is that in pathogenesis, we usually talk about a root and a branch in Chinese medicine. So Chinese have specific names for it. So the Ben, B-E-N, is something they call a root, right? And then Biao is what they call the branch. So branch is usually acute presentation that we see it up front, right? And it's usually what we treat first because it's acute. And then the root is something behind, right? The patients maybe had it from before. So if we go back to those syndromes that we're talking about, so we said that patient had the cold as an illness, and the primary syndrome or pattern, we said it was a wind cold invading the lungs. So that would be your typical example of the branch or Biao, right? So acute presentation, that it's more of symptomology. So branch treatment that we have to address because it's prevalent. It's right into your face. It's chief complaint. But then when you read it further down, you notice the patient has some other things that are not maybe directly connected with that branch. And they represent a longer pattern that existed before this acute illness or disease. And in our case that I mentioned, that will be like things like spleen Qi and liver blood deficiency. So that becomes your root treatment, right? So now we have three options here. Depending on severity of acuteness, right, you can treat, if it's very acute, first branch, right, or acute presentation, and then the root. So that's the first option. Second option, patient is presenting with not so much acuteness, so you can treat both together, acute and chronic, so branch and the root. And the third option, which is rare, there's very little of acuteness, and most of what you see is chronic. So you just go in and treat the root only. And then depends how many root syndromes you have, you would define the pecking order. So treat acute first or branch, treat both of them together, acute and chronic, or root and the branch, and then the last one, treat just the root, or what we call the chronic representation of the disease. So three options. Most likely, in your case scenarios, you'll get the first one. When you have severe, or somewhat severe acute presentation, and that's right into your face, so you got to treat that first, right? So in terms of forming TCM diagnosis, we know that TCM diagnosis contains both the illness and the patterns or syndromes. So ideally, your diagnosis can explain all of the signs and symptoms the patient has, but that's rare. So you'll need to find which illness and then is there, right? And then which syndromes, as in primary and maybe secondary, fit the most for the signs and symptoms that you're seeing it, right? In looking at especially syndromes, we use certain principles. So for example, we look at nature from 8 principles, right? And what are the 8 principles? Can someone tell me? So 8 diagnostic principles. Okay, so we have yin and yang, we have hot and cold, right? So 1, 2, 3, 4. We have excess and deficiency, 5 and 6, and what did I miss? So yin and yang, fullness or sometimes excess or deficiency, so 3 and 4. Hot and cold. What are the last 2? Interior, exterior, yeah. So those are 8. So in looking at those 8 principles, we look at sort of usually nature of pathology, right? In terms of its cause, we usually looked at more through another diagnostic system, such as the from Zhang Zongjing, from Shanghai Lun, 6 stages. So things like Tai Yang, Tai Yin, Jue Yin, and so on, right? And the 4 levels plus the 3 jiaos, right? And then, of course, we look at 7 emotions as well, right? Visceral organ association, and then miscellaneous causes. So these are some of the most common diagnostic systems we would use to diagnose, and they would be reflected in the name of the syndrome, right? So, So most common in terms of a deficiency is in terms of vital substances. So we have, in terms of a deficiency of the qi, we have deficiency of qi in lung, spleen, kidney, and heart. So for example, we have lung qi deficiency, spleen qi deficiency, kidney qi deficiency, heart qi deficiency. In terms of a yang as a substance, we have kidney yang deficiency, spleen yang deficiency, and heart yang deficiency. So these are most common ones. In terms of a yin deficiency, we have kidney yin deficiency, liver yin deficiency, heart yin deficiency, lung yin deficiency. In terms of a blood, we have liver blood deficiency, heart blood deficiency, and somewhat spleen blood deficiency as well. In terms of jing or essence, we have only kidney essence deficiency. In terms of the fluids, we have different sort of fluid problems in terms of a lung and large intestine, right? So these are in terms of a deficiency that we see. Of course, we have excesses as well. Liver is one of those organs, for example, that have excess conditions. So we have liver yang rising, liver fire moving upward. But that doesn't mean it's only liver. We have other organs that have excess pathologies, right? So that's another way to sort of define the syndromes, right? We also look at in terms of location. Where is the chief complaint? At what level of the tissue? Is it superficial? Is it going a bit deeper? Is it very deep? Like within viscera, within internal organs, or bone marrow, right? And that will define also where the problem is, right? So these are sort of like a shortcuts that can help us to define diagnosis. I'll talk with Alex to make you a copy of. Okay. In terms of treatment principles, we mentioned that we mention usually a primary syndrome, secondary syndrome if we have, and the illness. So whatever you define up there, you're going to sort of turn it around and define your treatment principle, right? So we may use some of the words such as release, warming, clearing, purging, harmonizing, reducing, tonifying, anchoring. So these are the common words we use in terms of whatever sort of syndrome is pushing. So for example, if we have the acid reflex, right, upwards, so person is reporting things like metal taste in the mouth, burning in the chest, that doesn't sort of looks like heart attack but not quite, right? Bad breath, halitosis, sort of urge to eat even when they're not hungry because of hyperacidity, right? So that would be, for example, one of the syndrome that we're looking here is rebellious flow of the stomach chi upward. That's probably rooted in some kind of stomach yin deficiency. So the syndrome may run something like stomach chi or stomach fire moving upward due to stomach yin deficiency and possibly liver chi stagnation where liver invades or stomach, right? So in that case, we need to do several things. We need to tonify stomach yin if that's where the problem is, so the root thing. But at the same time, we need to treat first that acuteness of acid going up. So, so we would read something like anchoring or reversing rebellious flow of the stomach chi, or quelling the stomach fire moving upwards, right? Then tonifying stomach yin, then harmonizing liver chi so it doesn't keep invading the stomach, right? So this is where the treatment principles will be. So whatever you set in your diagnosis, you would sort of reverse it in a treatment principle. Like, so you would show how would you treat those syndromes and on overall level, of course, the illness, right? So you have to ask yourself, are you addressing the chief complaint in your treatment principle? Are you addressing primary pattern? Are you addressing secondary pattern? And are you addressing the illness? So are you mentioning them in treatment principle? Because if you are mentioning, that shows that you understand what you have to do. So you basically showing them that you understand how to diagnose and you understand what your treatment principle will achieve. Because if you say in your diagnosis, okay, the patient has, let's go back to that upper respiratory stuff. So patient has as an illness, you put it cold. Primary syndrome, wind cold invading lungs. Secondary syndrome, spleen chi and liver blood deficiency. And then in treatment principles, you write something like treating the cold, building immune response. And they'll look, it says, where is that coming from? Why didn't you address what you just put in diagnosis? Where is the word cold? Where are the words for primary syndrome, like wind cold invading the lungs? Where are the secondary syndromes that you just mentioned, such as spleen chi and liver blood deficiency? Like, why did you left this out? So clearly they see that you don't understand diagnosis. You demonstrate to them. So whatever you put in a diagnosis, it has to show in some way in the treatment principles, right? It has to be congruent. Otherwise, it definitely, you know, you're showing that you don't understand diagnosis. So you gotta, at least that's how they see it, right? So you gotta avoid that. So then, of course, in treatment plan, you're now sort of addressing how you're going to treat your pathology that you just put it there in terms of diagnosing and putting treatment principles. So in terms of acupuncture, we're looking in about morning. Well, 4 to 12 points. Does that mean you cannot go with more or less? Well, I would say probably not less, unless you're some world famous doctor and you can do things in 2 points, right? If you're a world famous doctor, you wouldn't be here. So I would say maybe even more than 4, maybe 6 points. But I wouldn't go too many points because it will eat your time. That doesn't mean you can put 30 points. So what I would do is somewhere in a range. Put it like a medium points so you demonstrate to them that you understand how these points will treat the condition, which means the points in explanation of the points. So let's go back to that condition that we're mentioning. So a person has upper respiratory disorder, so he has a cold. And the cold is of wind cold invading the lung, first syndrome, with some spleen, chi, and liver blood deficiencies. So that means some of the first points will need to address the first syndrome, right, which is a wind cold invading the lungs. So, for example, you could put points like, I'm just making it up now, do 14, right? Which shows that you're going after sort of releasing some of that wind. Gallbladder 20, bladder 12 and 13, stuff like this, right? And then maybe down the road, you can add some points for spleen, chi, and liver blood deficiency, right? So you can put things like stomach 36, right? Ren 6, Shu high, spleen 10, spleen 6, and so on and so on and so on. So your first few points will be aligned with your primary syndrome, because that's what its priority, right? And then down the road, you're, somewhere toward the end, you will be addressing secondary syndrome if you have one, right? If you don't have one, then all the points are for that one syndrome, right? So there will be sort of order how you put these points. It would look really weird if you're putting it first points, for example, let's say spleen, chi, and liver blood deficiency, when that's a secondary syndromes. And you clearly put them as secondary syndromes. And you start, let's say, with stomach 36 and put it up there. And they're reading and saying it, he or she doesn't know the order of therapeutic principles. He or she should put first the primary syndrome points, and then maybe finish with secondary syndrome or syndromes, right? So take care of that as well. So the way you write diagnosis, that way you put the treatment principle, and that way you treat in terms of points, right? We need to put frequency. So how often you're going to treat these people. That means, let's say, the treatment will be 60 minutes, twice a week, for example, for 3 weeks, and then we would reassess, right? So you would actually give them some clinical protocol, like where are you going with this? So they understand, that you understand how would you treat things like, let's say, cold. So if I put it, things like, let's go back to that illness cold, with wind cold invading lungs and secondary syndrome of spleen, chi, and liver blood deficiency. And in my treatment frequency for the acupuncture, I'm saying things like once a week for 6 weeks. And they're looking like, wow, he doesn't really know what he's talking about. Here is the acute disease. This patient comes with acute respiratory disorder, and he's going to only treat once a week for 6 weeks. When we know that chronic, well, actually not chronic, like pathophysiology course of the cold is generally how long? How long cold runs the course? Yeah, we're looking no more than 2 weeks. Most likely 7 to 10 days. And yet I'm proposing once a week for 6 weeks. So it's not reflecting what I just diagnosed. So instead, most likely frequency should be something like, I don't know, every second day for 2 weeks, and then reassess. Why are we reassessing? We're reassessing for that other secondary syndromes, such as spleen, chi, and liver blood deficiency. So in our first 2 weeks, we should somehow treat first acute presentation that this patient is showing up, right? That should be a proper frequency, even every day for first, let's say, 4 to 5 days, and then move it to every second day for next 5 to 7 days. We can put that as well. But if I put it once a week for 6 weeks, it looks like I'm treating chronic condition. I am not. My diagnosis just said that it's acute condition, right? So that's what frequency should, so everything should be synced. Like whatever you put there in diagnosis, it should follow up in treatment principles, in a treatment protocol, as in points, as in frequency. And for herbs also, same thing goes. So proper formula or formulas, especially if you're going to include more than one formula. Modification if necessary, if you anticipating there'll be change in disease and the pattern, right? Length of prescription. If we put it there, let's say a 37-year-old with a cold, and he has wind cold, and you put something like um, guejutang, which is cinnamon twig decoction that we would use, let's say, to treat this wind cold. And I put it things like 2 grams twice a day for 6 days. What I'm really prescribing is, I had 27-year-old male, but I'm prescribing the dose for roughly 7 to 14-year-old. So my dosing is not reflecting who I'm seeing. So even there, they seeing that you don't understand how you're prescribing. You maybe get the right formula, maybe you even get the right frequency, but the dosing per square inch of tissue is off. So we got to look at that as well. In acupuncture, it's a little more forgiving, right? Because it's about needles, not about, at least on a paper. In clinical practice, probably not. But if you're prescribing herbs, you need to also take in account the age, severity, sometimes even the sex, is it male versus female in terms of chi or blood pathophysiology, right? So this needs to be addressed as well. So you got to be synced with whatever you're doing. And of course, the lifestyle. Would anything else help here in terms of it, what you're already doing in terms of acupuncture, tuina, gua sha, herbs? What would also enhance the treatment? Right? Sleep hygiene, nutrition, need to exercise or not, proper mental disposition, acknowledging environment. Someone comes with asthma, some of the lifestyle counseling would be, if possible, make sure that you don't have carpets in or as little carpets in your room or household because they collect the dust. Should be probably floor like this that you can easily manage the dust. Try to make sure that, if you're allergic to pets or something, that you're not around the pets. Make sure that no one is smoking around you, if possible. Remove yourself from smokers. Try not to eat allergenic food like citrus fruits, not too much dairies because they trigger allergenic reaction, so on and so on. So this would be sort of like in your lifestyle counseling, right? Maybe some self-care, like I don't know, if you have that first diagnosis of the cold with the wind cold, you could maybe suggest them for the congestion you currently have. You can use 10 drops of eucalyptus with 3 drops of lavender dissolved in 1 big vat of the steaming fluid. If you don't have like those steamers, right? To make the room more breathable for you and open the passages so you can sleep at night. Maybe using something like posumon or topical oil on the chest to relax the chest muscles from that cough you have and to allow you to open up your sinuses, right? So there's a number of lifestyle things that you can, if you have time, you can add to it. And that's just definitely a bonus. But I would say first take care of the diagnosis, treatment principle, your main therapies, and then leave at the end time for lifestyle, because it shows that you understand what proper care is, right? Because that's really a bottom line. They want to see, do you, not only if you're a clinician, but do you understand how to treat according to TCM and acupuncture? So this would be a short introduction to sort of how to diagnose, what are the elements of diagnosis, how they need to be synchronized if you're going to be doing them. And let's have a few minutes break, and then when we come back, we're going to continue with those 8 case scenarios that we're going to do it together. Nice summary. Yeah. Yeah. It's something we use here in the school to sort of like toward the end to help students sort of like streamline. When they graduate, we do the exit examination, and we sort of combine things and then to prep them for it, not just the. Sure. Mm-hmm. Sure. Thank you so much. Okay. Okay, so what we're going to cover now is we're going to go through about 8 clinical scenarios. They're taken from Machiucha, that golden book, the practice of Chinese medicine. So on the first page, we're going to have like a basic information. And on the second page, we're going to have answers, right? So I'm going to show you some of the, well, not some of it, all of the information, and then we'll try to figure out the answers, and then I'll show you the answers. Sounds good? Okay. So in this first scenario, we have a 45-year-old male patient with difficulty in falling asleep, followed by obviously palpitations. So, so symptoms described by patient: tiredness, poor appetite, slight anxiety, blurred vision, dizziness, poor memory. Information collected by you: pale face, tongue is pale, pulse is choppy. Okay, so based on this, what we're going to first do, obviously, we're going to create illness, right? So what I'm going to do here is, sorry? Maybe something similar like that. So here, so the others can, so first one is, oh, this one is markers, not writing well. Okay, let's try another one. Maybe third one is long. Okay. I'm sorry, guys. I gotta go grab a new marker. Okay, so the first thing is TCM illness. And then we have syndrome, S, I guess. And we'll put it, and then we're going to have a treatment principle. Okay, so 45-year-old male patient with difficulty in falling asleep followed by palpitation. Patient is complaining and saying he's tired, he has poor appetite, slight anxiety, blurred vision, dizziness, poor memory. You observing also pale face, tongue is pale, pulse is choppy. What's the disease or illness here we're looking at? Okay, insomnia. So illness, insomnia. Okay, that's overall umbrella now. How about syndrome or syndromes? What do you see in terms of a syndrome? Now, when looking at syndrome, you're looking at chief complaint, right? So inability to fall asleep with palpitation. So you're seeing it, insomnia, palpitation, two words flashing at you, right? And then some others: tiredness, poor appetite, anxiety, blurred vision, dizziness, poor memory. You know, from those 8 principles, which one is jumping at you here when you're just reading this, combined with the pale pulse and choppy pulse and pale tongue? Which one of, you know what I see? Deficiency. Like one word is jumping at me, flashing, and I say deficiency, because most of these are in some way caused by deficiency. Yes? Question is, deficiency of what? So we try to narrow it down, right? If you disagree, please. I would love, to hear what you think, because let's do this together, right? So we see insomnia, we see palpitation, and then most of these things point to deficiency of something, right? So what do you think is deficient here?
Deficient of a spleen reading.
Deficiency of the spleen, gentleman here is mentioning. Like which part of a spleen? Spleen chi, spleen yang, sometimes spleen blood actually. We don't usually say the spleen blood deficiency, but yes?
I would think heart blood deficiency.
Heart blood deficiency. Okay. Why would you think that way? Mm-hmm. Mm-hmm. Okay. Sure. That could. Okay. Both are you there? I mean, spleen and the heart are mother and a son, five element wise. The heart is the mother of the spleen, right? Both have huge role in blood, and we see here deficiency of the blood. Really, right? So, question is which one, right? Now we need to differentiate. Is it one? Is it two? Is it both? Mm. Right. Hmm. Like, right. What do you say? Blood. Okay. Both are in the blood, heart and the spleen. I mean, there are other organs. They're also involved in a blood deficiencies, right? You could say it if you want to play safe and just say blood, but then what you're telling them, you do know, but you're not sure of what.
If we talk acupuncture, you should target to reading.
I know, but right now we're just playing with the diagnosis still. Okay, so illness we said was insomnia. What will be syndrome? Give me some syndrome or syndromes if you want. What do you think is going on here? So there's not much information, right? And that's usually how the things will work. They'll give you some, but not all of it. So what do you think? Like which one of the syndrome would be the closest one? What you're looking is really is which syndrome, 3/4 of these things will fit in one of the syndromes. And if it's 3/4 in them, it gotta be that syndrome. It may not be the main one, but it is definitely that syndrome plus maybe some others. So, you're showing them, you know. So give me some syndrome or syndromes. We, mm-hmm. Okay. So give me some syndrome then. How would you call it? I need to put something here. No pressure. You're not an exam. We're just discussing it. You're not getting graded. Good thing you will be this. You will have books with you. Now, what's the main symptom or sign of spleen Qi deficiency that you would see? Because you have to ask yourself like that. Yes and no. Yes and no. Yes and no. One of the main things you see in spleen. So with the spleen, we see usually one or one of the three things. One, maybe easy bruising, right? Two, overthinking, right? Depends who's writing it. Three, lack of energy. So usually those 3 points, like these are not exclusive to spleen Qi deficiency, but they are one of the most common ones. Do you see any of these? You see tiredness. You don't see bruising, right? So is it spleen Qi deficiency? Yes. Sure, please. Okay, so far what we arrived to it is that we have illness as a disease or disorder, and we're working on a syndrome or syndromes, right? And what we notice is that we had deficiencies here, signs and symptoms, and we noticed that mostly they're at the blood level, but also at the Qi level. For example, tiredness could be Qi and blood deficiency, poor appetite as well, anxiety as well. Blurred vision is more blood, less Qi. Dizziness is more blood, less Qi. Poor memory is usually more blood, less Qi, right? Pale face could be either, right? So we're seeing it that it's tipping more toward the blood, but to get to the blood, you got to go usually to some pathology of the Qi. So it has elements of both, spleen Qi, or just a Qi or blood deficiency. But Qi or blood deficiency of what, right? So give me something. Come on, don't be afraid. You're afraid like you're in Canada Wonderland. You want to go first time on a ride. Nothing's gonna happen. Spit out something.
Well, I think heart blood deficiency.
Hard blood deficiency. Saying. What are you saying? Spleen chi. Okay, we can probably put both. We wouldn't be wrong, right? Spleen chi and hard blood deficiency. Anyone else? Come on, guys, speak up. I don't bite. Only when I'm hungry. And I had a good breakfast this morning, so I don't bite. So far, I only see two of them talking with me. Do you need a coffee? Maybe strong tea? Come on. We don't judge. Okay, I give up on you. So, heart, blood deficiency, and spleen chi deficiency. So that's what I got so far. So I got to work with what I got because you're not giving me anything more. Sorry? Spleen chi and heart blood. Sorry, what are you saying? Yeah, that's okay. Okay, so what will be a treatment principle according to this? So now you have it. How would you flip it? So what are we treating? What are we doing now? Tonify the blood. Okay, so tonify. Do we say heart blood deficiency or just the blood? You could, but you don't have to.
Invigorate the heart, tonify the blood.
So tonify the blood. Okay, tonify blood. Okay, comma. What else? Maybe chi as well, right? Because tonify blood and chi. Okay. You want to nourish the heart? Okay, we could put nourish the heart if you want. Okay. Nourish heart. Do we acknowledge disease? What do we do with insomnia? What would we do to insomnia? What word we would use with insomnia? No, I know, but we got to acknowledge insomnia. We didn't mention it in treatment principle. So we had tonify blood and chi, nourish heart, and what do we do to insomnia? Improve insomnia? Reduce insomnia? Which word we use next to insomnia? Normalize sleep. Okay, that's a bit ambiguous, but okay, we could do it. But normalize how, right? Maybe reduce insomnia. Stable. No, insomnia cannot be stable. You either sleep or you don't sleep. Improve sleep. Okay. Well, he is not sleeping well, right? And he's also having palpitation as he's sort of trying to fall asleep. So improve sleep probably would be one of those. Okay. And yes and no. There is no really very, very specific TCM. We were now translating in English. So you got to tell them what you're doing with this dude. This is your patient, right? What are you going to do? You could calm the mind, for sure. Nourish the heart. Okay, calm the mind. And mind here is Shen, or the heart itself. Very good. So that's very TCM, yes. Okay, now let's talk treatment. So, acupuncture. Heart 7, she says. Okay. Sorry. Terrible. One second. Q. Heart 7. Ren 4, she says. PC 6. Why UB17? Okay. PC6.
And there's something with UB17 that activates 15 and 14, right, to stabilize the mind.
Well, 15 would definitely be okay if you want to go for the sort of bladder 15 for the heart, yeah. But what do you need when heart is palpitating? Which organ is not anchoring the heart? So what would you add? So maybe kidney, bladder, maybe 23. You want to anchor it as well, right? Bladder 17, we put it. Okay. Anyone else want to add something?
No, it's just me.
Yeah, she's only talking. You guys are like sleeping. Come on. She puts you to shame. I don't bite. Maybe you didn't have a breakfast. Huh? Yeah, I know you did. So, well, okay, REN 14. Okay. Okay, REN 14. So, sorry. BL, yeah, over there. I put it.
BL 15 and REN 14
together. Okay. 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 What about herbs? Which formula? Anyone here TCMP? No one, right? Suaza Oriental, yeah? Yeah? Okay. Okay, ready to see the answers? Yes. Sure, please. Okay, so lifestyle. Room is dark. No drinking, you said? Sorry? Like, no, basically stimulants, like coffee, alcohol, chocolate, something like that. So, no. Okay, maybe not even eating, maybe late, right? Yeah. Okay, so no eating. Maybe, because that could be trouble out. Oh, sure, maybe. Okay, you ready to see the answer? Now, answer is not mine. Answer is from a Chiochi book. None of this is mine. Even the grammar is not mine. You notice there's some issues with grammar here. The first sentence. So, 45-year-old male patient with difficulty in falling asleep. And then with is back there. So, anyway. So, here we go. Here goes nothing.
Oh, yeah. See, we're both right.
Okay, so illness is insomnia. Actually, let me just move this a little bit. So we have heart and spleen blood deficiency, they're saying it. Very common type of insomnia due to deficiency of blood of the heart and spleen. Because blood is deficient, person cannot fall asleep easily. Or once in sleep, because yin is insufficient, he or she stays asleep. Tonify spleen, nourish the blood, tonify heart, and calm the mind. Acupuncture points, stomach 36, spleen 6, heart 7, REN 14, REN 15, bladder 20, bladder 15, PC6, spleen 4 into combination, kidney 9, and here are the explanations. And then in terms of formula, they went for Guipitang, which is ginseng and longan combination. It's a bit of a spleen chi and heart blood tonic, right? So cool. Yes. So what I would do is, if you're writing the points, I would hi. Good. I would write something like, for example, if you write, let's say, so here's one sec. So for saving the time and depending, so far from what I heard, it's on computer, so it will allow you, right? So let's say, so here's your acupuncture description. So you write bladder 15, and then right away next to it, explanation, right? and then I don't know, let's say spleen 6, and then explanation. So write them that way. So you don't have to do it twice. You don't have to do points, then explanation. That's just too much time, and you don't have time. You have 3 cases. For each one, you have an hour. That looks like lots of time, but only if you know. If you're shocked what you're seeing, you don't have time. Now you're in panic mode. So you better have like a sort of drill that takes you out of the panic mode. And drill is like, okay, this is what I write, no matter how I feel. Boom, 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 boom. And then I'll go and fine tune it. So my suggestion would be write it in this vertical way. Points on one side, description on another. Instead, let's put the points, then let's explain. Don't do that. Do right away description for them so they see it. And that way you connect your own thinking right away as it is. Instead, oh, let's just put points and then let's figure out what the point means. No. And lay them in order of your syndromes. So primary syndrome points first, secondary syndrome points second, if there is a secondary syndrome. And just boom, boom, boom. Just write it. Why you're putting these points. So they see a logic of what you're saying it. Because that's very clear. Yes?
So what if he had put spleen 2 deficiency and I had put heart blood deficiency? Would we both be wrong?
No.
Would they not
No.
pass us, or would they
I think they would, as long as you're close to it. And we can argue that there is a spleen chi deficiency here, right? But if you really went off the reservation, you're writing about Trong meridian, I don't know, or something. I'm just making it up. I mean, you could somehow probably connect. In TCM, everything is connected in some way, but it has to be close connected. Yes, not just like going somewhere just to write something. No, that's not going to work. Because then here it's going to fail you, because here you got to explain why you think so, and they'll say, well, no, that doesn't make logic. It may be like that, but it's not close to diagnosis. So no. You do know, but you don't know. You know marginally. That's what they would think of you. And you have 3 cases, so they'll average all 3 cases against you. And believe me, 2 will be probably easier. 3rd one's going to be a killer. They'll come at you with, oh, I don't know which one. Maybe first one is a killer. I don't know, but 1 of 3 will probably, what we heard, is strongest one. And that one is like backbreaking. They want to really see it. It's very close to call. 2 others are usually not that hard to call. Like they're very sort of general kind of ways. But the 3rd one, they go for a kill, just to see how you think. Right? Okay, great. I hope this melts you down a little bit, because I want more people to talk with me right now, because we have 7 more to go. So here's the second scenario. So main complaint, 40-year-old female patient with epigastric distension and pain radiating towards right or left hypochondrium. So it could be either. So symptoms described by patients: belching, sighting, uncomfortable feeling of hunger. Pain comes in bouts, clearly related to emotional tension. So emotional triggers, emotional stressors. Information collected by you. Person looks irritable. Tongue appears normal, body color with slightly red sides. Pulse is wiry. So some words are jumping on you right away. Let's see what words are jumping at us. Let's go from the bottom. Which organ is this? Liver. Red sides. Which organ is on the sides of the tongue? Okay, so we have double confirmation here. Whose organ represents to irritability? If I say I'm sad, no. Let's say I'm saying I'm sad. Which organ would that be? Sadness. Lung. How about I'm fearful? Kidney. But what about irritable? So liver, liver, liver. Okay. Pain is connected to emotions. Which organ is the most sensitive to emotional stressors? Okay. Uncomfortable feeling of hunger. Well, clearly not a liver, but liver is in the background maybe. Right? Maybe liver attacking the stomach or spleen, right? Sighting. Which one is that? Liver and maybe some spleen. Belching. Digestive, right? And then, okay, the main complaint. Epigastric distension and the pain radiating to our right or left hypochondrium. So we have here, but it's not just here, it's radiating. Okay. Okay, so he's prepared. What's the illness? So no, what's the illness first? Let's start with the illness. Epigastric pain may be illness. Okay, and the syndrome you said? Or a stomach. Okay, anyone agree or disagree? What do you guys say? Okay, so is everyone supporting him or contradicting him? You guys are going for free ride again, huh? Okay, so treatment principles. Too ambiguous. Give me, tighten up a little bit. So if your liver chi, yeah. Okay, to tonify spleen makes sense, but what do you do before tonifying spleen? Yeah, like work it out, warning a little bit. What we usually do is we take what you just said, liver chi stagnation causing a liver invading the stomach or spleen. So you use that sentence somehow and you twisted it a little bit. So maybe something like, yes. Sorry? So smooth the liver chi, maybe smooth the liver chi, and then what else we're doing with the rest of the players? That's only part of it. It was liver chi stagnation, and liver was invading who? Tonify the spleen. Okay, so smooth the liver chi, tonify the spleen. Activate liver chi circulation. Yeah, we could use that as well. So, okay, give me now full sentence. No. So liver is obviously a culprit, right? So we have to address liver first. So liver should be probably in the front of a sentence. Yeah. So give me now the full sentence.
Just the circulation, liver by dispersing the liver and regulating the chi.
Too big. Tighten up a little bit. I know. That's why, like, sometimes reading from TCM books, they give you this kind of almost like a Lego kind of blocks of the words, right? So one of them would be smooth the liver chi. That tells you a volume. It really tells you unblock the liver chi, smooth the liver chi flow. So smooth the liver chi. Probably nice TCM term kind of for here. So first part of sentence may be good, something like smooth the liver chi flow, right? And then tonify the spleen. And then, of course, we got to address the illness. What we're doing with epigastric pain. And reduce the epigastric pain. Would that work okay? So smooth the liver chi, tonify the spleen, reduce the epigastric pain. Okay, points. Acupuncture points. GB34, she's saying. Why? Remember, we're writing, like as I'm writing here, right? So if I put it, okay, GB34, what am I writing next to it? Why I'm picking GB34? So she's saying, okay, smoothing liver chi. Okay, remember, it should be about 3 to 5 words because you want to keep it short and concise, right? So what's the next one? Liver 3, she's saying it. Why? Sorry? Okay, let's do liver 2 as well. You can do either, you can do both. I don't think it's wrong. One is better than other, but 2 can be even better. 2 for 1 pizza deal. So I think both. So liver 2 is more for blood, right? Liver 3 is more for a chi, some say, and heat, right? So how about this? Balance, sorry, liver, blood, and chi. Okay, give me some more stuff. Remember, first one was about liver. UB18, she's saying. It's a bladder 18. Backshore point of the liver. Why? Balance the liver? Okay, so balance liver. Okay, let's jump on some other players here. Remember the order. So if we say liver first, 14. So bladder 14. Sorry? Liver 14. I apologize. Okay. Why liver 14? So front move point for the liver, right? So what does it do to liver?
Yeah, because they you use the BL18, you use LB14.
Okay, so she's talking Shu-Mu relationship, right? So both of this balance the liver. Okay, let's move a little bit more off the liver. Like this is good. Sorry, what was it? Stomach 36. So okay, stomach 36 because we're tonifying who? Spleen and okay. Anything else where we would spleen? SP3. Of course. Why SP6? Yes and no. May I just offer you my opinion? You're about 6 to 12 points. You want to find the best points. If you're not sure, then you throw spleen 6. But for example, what he says, spleen 3 would be good because spleen 3 is a U1 source point for the spleen. RN 12, of course. So, okay, why the 12?
Because they help your stomach.
Exactly. Okay, so both of these are tonifying stomach and spleen, right? Now, what about anything else throw for the pain in addition? Which point? SP15. SP15, he's saying. Okay. 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 How about herbal formula? What will we do here? Sorry? Chai Hu Shao, okay. Chai Hu Shu. Which one? Formula? It's the formula that comes from one small formula. One small formula is called Sun is Sun, or it's a 4 herbs, and there are this formula is building block for all the major formulas for liver and spleen, liver and stomach. So Chai Hu Shugan 1, Longdan She Gantang, Xiao Yao San, Jia Wei Xiao Yao San. Xiao Yao San is one of the most prescribed formula. It's Buplerum Dangwei. This is a cousin formula. So let's see what he's saying it. Let's see where we are. So epigastric pain, liver chi invading spleen, and he says this is extremely common cause of epigastric pain. Stagnant liver chi invades the stomach and impairs the descent of stomach chi. This results in stagnation of chi in the stomach and epigastric pain. From 5-element perspective, this is wood overacting on earth. Liver chi stagnation is usually due to emotional problems such as anger, resentment, or frustration. Soothe the liver and regulate the chi. Okay, so we're good there. Let's look at the points. Treatment plan. So formula, we're good. Chai Hu Shugan Tang or Shugan 1. Buplerum soothing liver decoction. Liver 14. We missed the PC6, but okay. Stomach 21, he's saying it. Ren 12 and stomach 36. Gallbladder 34. Okay. So far, you guys are good. You had a good breakfast. You're rolling well. Let's look at the next one. These are first 8 just to warm us up. Then after break, we're going to go for 16 where you're going to be writing.
Okay. Should I get something?
Sure, if you want to. Okay, so we have a 35-year-old female patient. Let me just remove this. Okay, go ahead, please. Sorry. 34-year-old female patient with slight hypochondria, pain and distension. Symptoms described by patient: premenstrual tension, depression, dizziness, insomnia, tingling of the limbs, blurred vision, scanty periods, tiredness. Information collected by you: frequent sighting, moodiness, tongue is pale and thin, pulse is choppy or fine. So, what's the illness here? Hypochondrial pain. Okay, so illness, hypochondrial pain. What are the words that are jumping here on you? Like when you look all this, what are you seeing? Do you see deficiency? Do you see excess? Do you see internal versus external? Do you see more yin, more yang, more qi, more blood? What are you seeing here? Like what are the words, like almost like flashing at you when you look at this thing? So if you look what she's telling you, right? Premenstrual tension, depression, dizziness, insomnia, tingling of the limbs, interesting. Blurred vision, scanty periods, tiredness. So if we're talking blood here, because, you know, when you see female patient, you're looking more at blood pathologies. When you see male patient, you're looking more at chi pathologies. That doesn't mean the males don't have blood pathologies and females don't have chi. But generally it's like this. So she's 34, she's female. Slight hypochondriac pain. It's not a strong one. What does it mean, slight? On a timeline. Slight hypochondriac pain. What does that mean on a timeline? Is this chronic? Is this acute? Is it, sorry? Short term, long term? Sorry? No, this is not in this. This is just to warm you up. You don't have this. So, what does it say? Come on, let's talk a little. When you see slight hypochondrial pain, slight, what is it telling you pathologically? So she's fairly young. She's a woman. Slight hypochondriac pain and distension. So it could be chronic, it doesn't have to be. But then, so you try to leverage this with this, right? See if this is connected in any way by this, right? She has pale tongue. What's pale means? Deficiency. Okay, so let's see if deficiency is a theme. Like choppy or fine, yeah, could be excess, could be deficiency, but if this is the tongue, most likely it's deficiency. Frequent sighting. What does that mean to you guys as a clinician? I'm a 34-year-old woman and I'm sighting a lot when I'm there in a treatment with you. Is it deficient? Is it excess? Deficient of what? You say spleen. Ooh, spleen, liver, heart. Okay, heart you say. Okay, why heart? Where do you see heart here? Yeah, you can see heart. Do we see anyone else here? Any other organ? You see liver. Okay, where do you see liver? Scanty periods, okay.
Well, liver blood, like it'd be liver blood, yeah.
What liver blood? Liver blood what?
Well, I'm thinking more heat because...
No, but liver blood what? Like, give me definition of liver blood. Deficiency, stagnation, blah, blah, blah. You can't go general. You have to go specific. Because they expect you to be specific. You go general, they'll say, come again for another $1,200. Yeah, so like tighten up, but that's good. Liver blood. So okay. So sorry, were you deficient or stagnant? So liver blood deficiency, she's saying. Okay, tingling lips, yeah. Blurred vision, yeah. Scanty periods, yeah. Tiredness, dizziness, yeah. This could be all liver blood too. So when we're not sure which organ it is, what we do is we run it against tongue in a pulse. And that sort of moves to one or another organ. It confirms which one is it more. So we see the heart, as you mentioned, and we see also liver, right? Liver is mother of the heart. So, but which one is more prevalent? So does choppy pulse sometimes, yeah, could be liver, could be heart. Pale and thin, that's more what? Heart blood or liver blood deficiency? So he thinks heart, okay. Okay, anyone else, guys? Okay, let's talk. So which syndrome it would be? She's saying liver blood deficiency. You're saying what? Heart blood deficiency? Heart yang deficiency. Okay, heart yang deficiency, we would have palpitations. We would have also coldness. So yeah, I would say no. No, not heart yang. Heart blood maybe, if you would still with the heart as organ. Yeah, maybe even heart chi to some degree, but deficiency, yeah. Okay, so she's liver blood deficiency. Are you still with the heart, and what in the heart? Or you swing to her? Liver. Yeah, there's definitely, but is it enough to call it heart something, right? That's what I'm saying, it, right? I'm not against it. I'm just saying it isn't enough. Like, you know the rule I mentioned, 3/4? Does it 3/4 of signs and symptoms point to your syndrome? If they do, please put it on. If it don't, you can add it maybe later, right? But so what's the main player here? What's the main syndrome? So liver chi stagnation. Why? The moodiness, okay. But would liver chi stagnation cause things like insomnia? Yes. Dizziness? Yes. Tingling of the limbs? Yes. What about blurred vision? No. Scanty periods? Not as much. Tiredness? Only secondary. Premenstrual tension? Yes. Depression? No, only secondary after the. So liver chi means this: you erupt and then you go down in deficiency. So first is excess, then it's deficient, right? It's kind of like volcano. You build, boom, you erupt, and then you have deficiency, you slump, right? So for liver chi to be there, yes, it's there, but is it primary syndrome? Maybe, maybe not. I'm just playing devil's advocate here. Okay. So liver blood deficiency, liver chi stagnation. Which one is it? Could be both. But for liver chi stagnation, you would see some stronger pulse, like more like a rigid pulse, right? And if you have liver chi stagnation, it leads eventually to liver blood stagnation. Liver yang raising, no, very, very strong. You would see more of that. So you would see hypertensionness. Yeah, you would see also tinnitus. You would see hypertensiveness, change in a heart rate, in a respiratory rate, because it's more of an eruptive kind of excess condition. But you don't see it as much. You would see more irritability. She's just moody. She's not irritable. That there is a difference, right? And it's slight. Slight pain. Here they're already setting the stage. Everyone just jumps over the slide and see hypochondrial pain distension. But they're setting the stage. They're setting the tone. Slight. Don't miss it. Yes? Okay. Where's the kidney here? Where do you see kidney? Blurred vision. No, that's more liver blood. Rarely kidney has a blurred vision. Main things for kidney you would see here: tinnitus, low back pain, because kidney is opening in the ear, right? So no, there's no kidney much here. There's kidney in the background somewhere here, but not at the front where we want it. Because we're looking at front now. What's the syndrome? Okay, so which one we're going with? Liver what? So she's saying that she's abandoning liver blood deficiency. She's going to liver G stagnation. Anyone against this? You with her or you against her? Okay, so liver blood what? Deficiency. Okay, so okay. So let's leave it there for now. How about points? What would you give me now, based on what you're seeing it here?
Now we use LV3.
Sorry.
Now we can use LV3 now.
LV3. Why?
Because that's for
Chi?
improve
Improve the liver.
blood.
Chi and blood. Okay. What's the next point? A little bit, yeah, but not main insomnia point. Okay, sorry. Let me just put this here so guys on a computer can see it as well. Okay, so liver 3. What else? Give me some more. Sanjiao 6, she's saying it. Why? What's so important about that point? He's saying it. Okay, so I will change it. Sanjiao 5. Why Sanjiao 5? And it opens your body toward outside, right? Okay, so it smooths flow of chi. Okay, we're gonna just stay with 2 points. Bladder 18, he says. Bladder 18, so that's the liver, right? Remember what he says. If you're gonna use the back, maybe you should use the front as well, which means you use the liver 14, right? Together. So for the liver. Okay, what else? I mean, it's a nice start, but it's not enough points. Okay, so LV13, you're going for spleen, right?
LV13 the whole body, all the liver or internal organs.
Okay. Okay, so spleen here, because that's a front move point for the spleen, right?
For liver, for spleen.
Okay, okay, so you're seeing more that works on the liver, okay. Okay, so smooth, okay, so smooth the flow.
For liver, for spleen.
Chi flow, okay, smooth the chi flow, okay. Spleen 10, she's saying it, okay. Why spleen 10? Sea of blood, okay. So, sea of blood, okay. Okay, so we have some nice points here. Maybe a few more. GB34. Why GB34? Tingling of lips. Okay. Anyone addressing vision here? GB20.
Remove the blurred vision.
Blurred vision. Okay, so GB20. Yeah, yeah, could. But GB34 could work as well. I mean, not for vision, but for overall smoother flow. Okay. Heart 7 for insomnia. Yes. Heart 7. Okay, for insomnia. Okay. How about herbs? What would we put for herbs here? Any idea? So remember, we have slight hypochondrial pain and distension. Hypochondrial, that's what? Where? Center? Sides? Bottom? Epigastric? Where's epigastric? Here, right? Hypochondrial is where? Sides? Okay. Okay, let's reveal where we are. So I'll talk with Alex. So hypochondrial pain, okay. Liver blood deficiency. So I guess, yeah, you were right there in the beginning. This is a very common condition, especially in women. Why? Blood physiology for women, chi physiology for men. Nourish the blood, soothe the liver, move the chi. Stomach 36, spleen 6. Ren 4 and liver 8, nourish the blood. Liver 14, gallbladder 34, liver 3, and Sanjiao 6, move the liver chi. PC6 moves the liver chi, calms the mind, settle the hunt, hence the insomnia. Gallbladder 41, used in women if there is a feeling of distension in the breath. And sighting. When you're sighting, you have usually like what they call like someone sitting on your chest feeling, right? So you're sighting, you almost like want to release all that pressure, oppression, right? Shao Yao San is the formula. Okay. Good. Good. Okay.
What's the one that's really common for premenstrual? Is that it?
Shao Yao San, yeah. The most common prescribed formula in Chinese medicine. Why? 85% of clients are women. And this is the formula that works on the liver and spleen. So it's by default the most common prescribed formula. Yes. Sure. Mm-hmm. Yeah, some, not all. Yeah, yeah, they're good enough. Yeah, 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 they're good. He tightened them a bit more. That's his opinion. Like you have really a box in Chinese medicine. So you gotta when you have a syndrome, you gotta be somewhere in this box. Obviously, more toward the center is better. If you're outside a box, it's not good. Right? So you are in a box. Question is how close you are. You went for chi stagnation, so you were more toward the chi stagnation. Yet they went for liver blood deficiency. Right? So, okay. Let's do one more and then we're going to have a break. And then we have 4 more to go through. Excuse me. So, 37-year-old female, patients complain of hard, immovable, and painful mass in abdominal region. Symptoms described by patient: feeling cold, amenorrhea, painful periods, information collected by you, dark and withered complexion, tongue is purple, pulse is choppy. So let's look at the first sentence. So we have 37-year-old female patient complaining of hard, immovable, and painful masses in abdominal. Most likely lower abdominal region, most likely. They're not saying it, but. So she's feeling cold. What's amenorrhea? No period. And then so I guess some periods, because she has painful periods, and amenorrhea, right? Dark and withered complexion. Tongue is purple, pulse is choppy. Okay, so let's start from the bottom. Choppy and purple pulse. Is this excess or deficiency? Sorry? Excess, she says. Excess of what? Like, what kind of excess condition we're looking here? What's the purple? Stagnation. Stagnation of what? Of the blood. Okay, so we have excess, that it's actually stagnation of the blood. Okay, dark and withered complexion. Does this aligns with what we just said? Yeah. This blood stagnation would cause eventually dark and withered complexion. Eventually, which means the timeline is long term. So this is going on for months at least. So it's chronic. Painful periods. No periods feeling cold. So the blood stagnation. Sorry? Yeah, no, please. Liver blood stasis, she's saying it. Okay. So what's the illness first? What's the illness? I guess we could call it abdominal pain, but is the pain here the main thing? Okay. Yeah, we could call it mass in abdomen. Yeah, yeah, we could call it mass in abdomen. And then for the syndrome, what did you say it was?
Liver blood stasis.
Liver blood stasis, she's saying. And everyone agree, disagrees with her? Okay, so we have blood that's stagnated. More so, it's liver that sort of cause this stagnation. So what kind of points would you give me? Liver 3, she's saying. Why liver 3? Heat in the blood, and she's feeling cold. So something is wrong. Well, not for addressing her heat, because she doesn't have any. She's feeling cold. So I would maybe put a different explanation if we're going to use liver 3. So, okay, to break stagnation, that's what you're saying. Like, okay, then what would you couple liver 3 with? Remember last time I mentioned the 3 circles, the open circulation. Remember that the very outside circle was the weakest one. It's called 4 gates. What's the other point?
Liver 4 and...
4 it is, yeah.
Large intestine 4
and liver 3. Okay, so 4 gates. Yeah? Do 20.
With the 4 gates?
LI4 and
LV3. Okay, what's the second circle we said? Yeah, no, yeah. It's a good. Yeah. Well, what's the second circle I said? So the outside circle was 4 gates. You guys were here, most of you. So spleen 10 and bladder 17 was second circle. And then the last circle, the tightest one that opens the most systemic circulation, was the Sanjiao 5 and PC6. You better write this down. It'll serve you well in a clinical thing. You never use all 3 together. This is the 3rd time I'm mentioning these 3 circles.
What did you say if you use all 3 together, what can happen?
Syncope. What's that?
Oh, okay. When you pass out.
Yeah, your blood pressure evens.
Blood pressure drops.
Yeah. Well, not drops, evens. And then you pass out because you just create so much systemic movement that your systolic and diastolic will eventually, through hormonal stimulation, will even, and you'll pass out, which is not good.
When you first mentioned this, you were talking about headaches, though.
Well, headaches are part of stagnation of different things. Yeah, you could use it some. So, but okay. So 4 gates would be a good one. What else? Let's stay with the liver blood stagnation, as she's saying it. What else we would use for it? So, yeah, if you have blood stagnation, you probably have Qi stagnation as well. Yeah, Qi deficiency, you're saying. Liver Qi stagnation. Okay, so he's saying a liver Qi deficiency that leads it to liver blood stagnation. Okay. Okay, so what points we would add? 17. Sorry? 17. Bladder 17, okay. Yeah, bladder. Yeah. Anything else? Spleen 10. But remember, that's 2 circles you're using together. I wouldn't go for 3rd one. So I wouldn't add Sanjiao 5 and PC6. You can use 2 of these together, but 3 never.
I wasn't thinking of that in terms of the circles.
Yeah, but it would have a systemic effect.
Okay.
Yeah, just to mention.
Wouldn't that be enough then?
Yeah, that would be. No. But you got to tune some other things. You got to address some other things. GB34. Okay, maybe. Ren 6, she's saying it. Sure. If you want to tonify the Qi, stomach 36 maybe too, right? Okay, let's have a look. Because of seed, you're losing a focus. So maybe we're due to the break. So abdominal masses, okay, so that was good. Blood stasis nodded in interior. So maybe not liver specifically, but it's implied.
I would never guess. I would never even think of.
Okay, that's why you guys are going to have a books with you. Something that...
That's not even...
Okay.
Yeah, I've never even seen that.
Right. Sure, you could call it blood stasis in abdominal region or middle jaw or lower jaw, whatever they're implying it.
Did you say tied in the interior?
Yeah, you could. So this is a TCM term. You know, yeah. So severe and chronic stasis of blood with obvious masses, dark and withered complexion reflects stasis of blood and a cold feelings due to internal cold. but also to poor circulation of body in the blood. So not blood is not leaving the core. It's not going to extremities and back, right? So look at the points. So gallbladder 34, REN 6 to move chi and blood, spleen 4 and PC6. So they're going for Chong meridian. Chong is the one. So they hinting that it's actually lower abdominal area. When you use the Chong, it's used to open the portal circulation. And since you have stagnation of the blood causing masses, so we're looking probably possibility of fibroids, tumors, whatever else is going on in abdominal area. Maybe even endometriosis in the background, right? And then we have spleen 10 and bladder 17, right? Stomach 29, liver 3 and spleen 6. So they're not adding large intestine 4. Liver 8, stomach 36, and bladder 20 to nourish the blood. And they're using cinnamon and poria pill. Guager Fuling 1, right? So this is a gynecological condition, obviously. Right. Okay. Let's have a maybe 10 minutes break. So we just reset a little bit, and then we're going to come back. I'll ask him. Yeah. Okay. So let's continue. So here's the case scenario number 5. So we have 50-year-old male patient with urge to pass the stool, but with difficulty in doing so. So basically, symptoms described by patient: difficulty in opening bowels, feeling of exhaustion after bowel movements or passing of fecal matter, thin and long stool which are not dry. Information collected by you: pale complexion, tiredness, tongue is pale, pulse is empty. So let's start from the bottom. Empty pulse and pale tongue. What are we talking about here? Of what? If you tie it with this, so you have a 50-year-old male, and male patients have more pathology on what side, chi or blood? Chi. And he has urge to pass the stool, but difficulty in doing so. So deficiency of what here? So is he constipated? Let's start with illness. Is this constipation? Well, I don't know. How would you call this illness? No, illness. Syndrome and illness are not same things. How would you call this illness or disease? No, I'm asking you guys. What would you call constipation? She's saying. Okay, you guys agree or disagree? Agree. Okay, so what syndrome we would talk about? Stomach yin deficiency. She's saying it. Why? So large intestine what? Deficiency what? Chi deficiency. So he's saying large intestine chi deficiency. Yeah.
Exhaustion after.
Mm-hmm.
Dry stool.
Well, yeah, I mean, yes and no. I mean, thin and long stools which are not dry. So they're like, yeah. So, okay, so everyone for or against a large intestine chi deficiency? Yes, so what are the treatment principles here? Acknowledge disease, acknowledge the syndrome. How would you call it? So how would we, now that we have disease, we have constipation, we have a syndrome, large intestine chi deficiency. What are the treatment principles? How would we call it now? Move the bowels, okay. Well, if he's deficient, what will we do? What do you do with deficiency? You tonify. Yeah. Yeah, stimulate or tonify what?
25, stomach and large intestine.
Okay, that's a good one. Okay, and then
Also the Ren.
Ren?
Also Ren.
Mm-hmm. Okay. So what points we would use here?
ST36, I11.
So Stoman 36 is saying it then.
ST36, REN
RN
12,
12, okay.
and ST25,
Stomach 25.
11.
LI11, okay. So
Also
lung,
LU3.
lung 3. Okay. So stomach 36 to tonify the chi overall of gastrointestinal system. Then we have REN 12, the front move point of the stomach. Stomach 25, front move point of large intestine. Right? And then lung 3. Right? Okay. Anyone else want to add any points? Sorry? Lung 3. Why are we including lung 3? Why are we including lung 3? For bowel movement. So lung 3 actually...
Special bowel movement or
Lung 3 induces the peristaltic movement in intestinal wall, actually. Okay, any other points? Hugu, large intestine 4, yeah, good point. To go? Okay, to go. Oh, the extra point, right? Yeah, okay. What herbal formula we would give them? Anyone knows? Okay, let's see the answer. So constipation is illness. Syndrome differentiation, Qi deficiency. Here it's due to spleen and lung Qi deficiency. They're saying it tonify Qi and moisten the intestines, right? Bladder 21, bladder 25, spleen 15, stomach 36, Ren 6, spleen 6, lung 7, bladder 13. They putting it there, right? And the herbal formula is Huang Qi Tang, astragalus decoction. It's usually used for lung and spleen Qi deficiency, right? Can I go back up? Yes, I can. There we go. Well, of course, but Alex gave you all the pages, so you can cheat, right?
Yeah, that's constipation, always dealing with food. Okay?
Right. So what he's saying is that in constipation, we always deal with hollow organs, or so-called fu out of the zang fu. So the junior partners. So you're not dealing with solid organs like zang organs, right? It's like a lung and spleen, but instead you deal with organs like stomach and large intestine, right? I'm just, excuse me, I'm just going over it what he put in the book.
Yeah, I know, but just say,
Mm-hmm.
from the viewpoint of the principle,
Yeah.
that I don't agree.
He was still right, still accurate.
Well, there are many forms of constipation or lack of a bowel movement. Some are very fu-oriented, most of them. Some are actually zang-oriented. Nothing in Chinese medicine is yang or yin. It's always a yin and yang. Problem is that some are more yin, some are more yang. So you always have both functional and structural diseases. Every disease has a structural and functional pathology in it, but one is more dominant. So what he was trying to say is that in case of constipation, functional disorders are more dominant and structurals are not. But we do have them, right? So scenario number 6, we have 8-year-old male boy or patient complaining of strong forehead-based headaches. I hope you don't look in answers, because this is due to you just to train yourself. So he has forehead-based frontal headache right after late night binge eating. Symptoms described by patient: feeling of fullness in epigastrium, sour regurgitation, information collected by you, belching, full breath, halitosis, tongue is thick and sticky, well, tongue has a thick and sticky coating. It doesn't say about what the color of tongue is, and pulse is slippery. So is this excess or deficiency? Why? So it looks more like excess, but excess, he's saying it excess of like dampness basically, right? And where is this dampness coming from? Yeah, so 8-year-old boy. So kids have, which organic system is the last one to mature in children? Digestive. He matures between 10 and 12 years of age. Spleen and stomach are the last system that matures in children. That's why children have so much digestive issues. And we have 8-year-old, and it's a boy, so it's more about chi, right? And then he's doing a late night binge eating. So he's eating what I call 3 W's. Wrong food in wrong quantity at wrong time. 3 W's. It's not WWF, World Wide Web. It's something else. Wrong food in wrong quantity at wrong time. Think about it. He has a strong forehead-based headache. Which meridians are at forehead? Well, few, right? But particularly here, which one is overwhelmed? The one that it matures the least, right? Stomach and spleen. But spleen is partially there, stomach, right? Feeling of fullness in epigastrium, stomach. Sour regurgitation, stomach chi rising like rebelliously upward, right? So body's trying to purge itself because he ate too much food at wrong time and wrong food, right? Belching, full breath, so everything is pointing to it. Like the system is trying to purge itself, right? Thick, sticky coating because the stomach and spleen are overwhelmed. We have like dampness, right? Slippery pulse means stagnated, right? So what is the disease here? Sorry? Okay. Stomach food retention. Okay. What's the syndrome? See, you're making big mistake. You have to keep with illness and then syndrome. That's a Western training in you, right? I used to do this for like first 10 years. I would just go with disease and forget about syndrome. In TCM, everything is a syndrome. Disease is just something that's above us. We acknowledge it, but we don't treat according to disease. It's hard to empty the cup. I know. Okay, so what's the disease here? Illness, disease, yeah. What's the illness here? Disease, pathology, whatever you want to call it. If this patient shows up in your clinic, what would you diagnose it with? Okay, yeah, we could call it headache. I mean, that's a prominent thing, right? He has strong forehead-based headache. We could. Why not? Yes. Yes. Yeah. Okay. So the disease is, I guess, she says headache. Everyone agrees or no? No? What are you calling it then? Okay, so she's saying, but it is chief complaint. He is complaining mostly of forehead-based. For him, that's the main thing. He says, please, please, please help me with this. And this is a strong base forehead headache. So what we think as a clinicians gets overridden what the patient says, right? Because, but then later when we do syndromes, that's when we decide what exactly is going on. So step 1, step 2, right? So now in a syndromes, what are we talking about syndromes? What syndrome is this? Oh, no, that will be very chronic stuff. Remember, dampness takes time. This is acute stuff. This is like, it just happened now. He just ate and they brought him in your clinic, so it's acute. So you were saying food retention. Okay. Okay. Everyone agrees? So what's the treatment principle? Let's acknowledge disease or illness and the syndrome. How would we call this now? Remove food stagnation, coma. What's after? Yeah, we could call it relieve headache or reduce the frontal headache. Yeah, we could call it. Anyone else? Like, how would you call it? Yeah, resolve headache is good too. Let's see what they're having. So they're calling it a headache, food retention, right? This type of headache is more common in children. It's usually experienced on a forehead, can be intense. It's obviously related to 3Ws, right? Frequently encounters acute headache after dietary indiscretion. Treatment principle: resolve retention of the food, stimulate descending of the stomach chi, belching and bad breath, right? Promote digestion, harmonize the middle. They're not mentioning headache. I would, because that's the chief complaint, right? Acupuncture treatment: REN 10, stomach 21, PC 6, you know, stomach 34, stomach 45, lots of stomach points, right? Large intestine 4, stomach 8, right? Herbal prescription, another second, probably most common prescribed herbal formula in Chinese medicine, Bao He 1. Preserve the middle or harmonize the middle. Bao He 1 is used not just for food stagnation, but it's used to buffer stomach before you take strong formula, especially formulas that will like increase acidity in your stomach. So you take, that's why it's the second most prescribed formula in Chinese medicine. Bao He 1, some versions of formula have Bo He or like mint. Yeah, mint family, yeah. Either spearmint or mint, yeah. But they have digestive foods, but they also herbs that control acidity of the stomach and coating of the stomach, right? Okay. So scenario number 7. 58-year-old male presents with strong wheezing with a loud noise that happened after eating late night dinner of KFC deep fried chicken. I added KFC, I just couldn't help it. It's not original in the book. Symptom described by patient: feeling of heat, red face, bitter taste, and a thirst. Information collected by you: breathlessness, distended chest, cough, irritability, tongue is red with yellow thick coating, and pulse is slippery and rapid. So what disease we're looking at here? Illness. Wheezing. Okay, everyone agrees with wheezing? Yes. What syndrome are we looking at? Sorry? Okay, that's not quite a syndrome, but okay. Yeah. Yeah, what kind of syndrome are we looking at here? So feeling of heat, red face, bitter taste, thirst. So it's excess, right? Cough, irritability. You know. So which organ is popping up here? Yeah, liver is irritability. Red face, bitter taste. Yeah, that points to liver. What else we have here? Yeah. Lung. Well, wheezing and breathlessness is lung, right? Yeah, and kidney, yes. Thirst, also kidneys, right? Thirst and feeling of heat could be kidney, like especially kidney deficiency. Yeah. So let's have a look what they're saying. wheezing, hot phlegm. Excessive consumption of sweet and greasy foods injures the spleen. So treatment principle: clear the heat, restore the descending of the lung qi, hence the wheezing and cough, resolve the phlegm. So here phlegm is basically gluing and dampness, the movement of the qi. So the qi cannot descend down, and instead it goes up. So the hot phlegm. So, okay, so you know how we, okay. Okay, so in Chinese medicine, we have a superficial pathology that if it's not treated, goes to the deeper pathology. So let me give you examples. So your qi deficiency will become eventually yang deficiency if it's not treated. Your blood deficiency, if it's not treated, can progress to become yin deficiency. Like in kidney, this is the order, like textbook order. Let's say you start with kidney qi deficiency. If that's not treated, you go to kidney yang deficiency, then to kidney yin deficiency, then to kidney jing deficiency. Obviously, not everyone goes that order. But so you see it how we go deeper and deeper and deeper. So damp heat, if not treated, can cause this kind of thing, hot phlegm, right? Or heat damp, yeah. So heat, yeah, heat damp. So damp heat and heat damp is different. Grammatically doesn't make sense, but first pathogen is 70% of pathology. It's a main pathogen. The second pathogen named is 30% and minor pathogen who gives the flavor of pathology. So if I call someone damp heat, in diagnosis, it means the dampness is 70% of that pathology. It's a main pathological factor, and the heat is giving a flavor of it, if you will. So here we have hot phlegm, which comes from from heat damp, where the heat is main pathogen and damp is the secondary. If it's not treated, it progresses to hot phlegm. In certain cases, it could actually become, you may go express there, especially if you already have heat dampness in you for a while, right? And then, like, for example, so let's say he was ingesting this kind of foods for months and years. Eventually, the phlegm and heat builds in it. And then one night, he has just pushed too much beyond, and he ends up with this kind of hot phlegm pathologies because he was he was heat damp for many years or months, right? That's what authors are trying to tell you. So you need to know progression of pathologies, how pathologies progress if they're not checked or treated, right? That's why to you maybe this doesn't make sense because it just landed in middle of nowhere, right? But it didn't. This person, if you look to age, probably, eat this kind of food, was not exercising, so it's probably obese, his system couldn't handle it, or he was handling by giving him heat damp for a while, and then after that, it took one episode to push him over the brink. Yes?
What would be the typical
long-term dampness?
More the lungs than anywhere else, though, right?
Yeah, the saying in Chinese medicine is this, that spleen creates the dampness and phlegm, but the lung is housing it.
Okay, so, but hot phlegm can fall into any organ, right?
But it's generally more prevalent in lungs.
In lungs and
spleen. Never in a spleen. Spleen makes it, but it doesn't house it. That's what they're trying to tell you here. That's why I'm giving you these mnemonics. These mnemonics are equivalent of 500 plus pages of physiology. So it's chunking. You know how we memorize through chunking? Well, Chinese start chunking in the 1st century before Common Era. We know this from turtle shells. So they start saying these medical mnemonics that are very poetic, and nothing to do with poetic. It's about chunking, about taking so much knowledge and chunking in your brain so your short-term memory can recall it from long-term memory. That's why they can look, like a book that's 5,000 pages and in 20 mnemonics recite it. So spleen is making dampness and phlegm, but the lung is housing it. There's so much said here, right? Physiologically and pathophysiologically. Yes? Okay, so breathlessness generally is due to the lung qi moving up. And breathlessness and wheezing happens for 2 pathological reasons. One, your lung qi is weak to descend, so lung qi deficiency. 2, there is something obstructing lung qi, so it can't go down, and that's usually dampness or phlegm. And 3, you have both together. Like you're lung qi deficient, plus you have a phlegm or dampness, and it's obstructing lung qi descending, right? So, so that's where they're pointing to it. So the treatment plan here, lung 5 to resolve phlegm heat, right, from the lungs. Lung 10 to clear the lung heat. Lung 6, lung 1 and bladder 13. So lots of lung point, large intestine, LI11, I apologize, to clear the heat. PC5 combined with stomach 40. Stomach 40, as we know, is a phlegm point. So what stomach 40 does, it digresses the phlegm into the dampness. Remember, long-term dampness is the phlegm. You can't just go in the body and remove the dampness. For visualization, this is what I tell my students. Think of dampness like a milk. You can get rid of it through sweating and urination. But think of phlegm, which is a milk that turned into yogurt. Can you just go in a body and shovel it out yogurt? No. You're going to digress the yogurt into milk like a fluid before you get rid of it. So stomach 40 is one of those points. It basically reduces the phlegm or thicker pathogen over the time into the sort of common denominating pathogen that could be removed from the body through sweating and diuresis, urination, right? And in REN 22 here is local and systemic point to resolve the phlegm, to deblock the lung in the neck. So the lung qi actually can go down, so it stops the wheezing and the cough, right? And the red face, and the oppression of the chest, and the sighting, and whatever else goes with REN 22. So herbal formula here is Ding Chuan Tang, very known formula for wheezing, for asthma, where like you have a blockage in the neck. Actually, there are points at the back that we would use also there called Ding Chuan as well. Right? Okay, let's look at scenario 8. So we have a 20-year-old female patient presenting with dry cough, dry. Always pay attention to those small words. Don't gloss over them. They're like really should flash at you. They're like steering you. They're setting the tone. Dry cough with tickling sensation in the throat. Symptoms described by patient: aversion to cold, fever, sore throat, slight sweating, body ache, headache, runny nose with yellow discharge. In other words, flashing at you. Slight thirst, slight dark urine. In other words, flashing at you. Information collected by you. Shivers, sneezing, tongue is red on the sides and the front, pulse is floating and rapid. What do you think is happening here? What's the illness? Well, no, illness, disease. What's the disease here? Not syndrome. Disease, guys. Illness. So he's saying cough. Are you guys with him? No. Disease. Disease. Not the syndrome. Bing. Bing-jen. Bing-jen. Not jeng-jeng. Bing-jen. What's the disease? Cough. Keso. Right? Okay. Now let's look at syndrome. What's the syndrome? So, yeah, there's something going on, yeah. So, sorry? No, they just give you like a little, enough to go on, but not enough for you to make it easy, right? So she has aversion to cold, fever, sore throat. So it has elements of both, wind heat and wind cold. Sore throat is with wind heat, but aversion to cold is also wind cold. So they're making it difficult for you. They're not making it easy. It's not very clear cut. And So you know what it looks like? Wind cold that turned into wind heat eventually. But you can't say this. You gotta either pick wind cold or wind heat. Well, you could. You could say previously wind cold, now wind heat. I don't know. Or like a wind heat secondary to initial wind cold syndrome. You can call it that way. It sounds very medical, right? Um, well, it could be. So let's see what they're saying. So cough is illness, invasion of wind heat. So now it's wind heat, but it used to be probably wind cold because aversion to cold and everything. So within first 36 hours, if they come, and rarely they do, if you caught them, it would probably wind cold. You would have more like a runny nose with white discharge. You have less of sore throat. You would be less of thirsty. You would feel more of shivering and cold. And we would treat it as a wind cold. But after 36 hours, this becomes embedded in the tissue and it starts looking like a wind heat. Why? Because the pathogen is deeper in and Wei Qi or immunity is attacking and fighting against. Now heat is made. So then sore throat, thirsty and everything. So it looks like wind heat and it is wind heat, but originally it was not wind heat. It was a wind cold. So depending when your patient comes, you treat it according to that, right? So here we're releasing exterior, expelling wind, clearing heat, restoring the sending of the lung qi, because remember, cough is lung qi that's moving opposite of his direction. Why? Because in this case, the pathogen is decreasing lung qi. So the lung qi cannot descend, so hence we get a cough, right? So the treatment here we have is lung 7 and bladder 13 to release exterior, particularly release the wind, and move the descending qi down. Large intestine 4 expelling the wind heat. Bladder 12 release exterior. Large intestine 11 wind heat again. Do 14 release the heat. Lung 6 accumulation points stops acute cough. Sang Eugene, Morox, and chrysanthemum decoction is the one that we treat here for it. So chrysanthemum in it is, and Morox pointing you that this is now cooling decoction, but because it's safe to use, because it's not wind cold anymore. Now it's wind heat. So in biomedical thinking, your viral load was initially light, and that's why you have shivering. But eventually the viral load in your blood and your interstitial tissue increased, and your immunity is now fighting at the deeper sense of the body, deeper tissue. That's why you're now having more of an inflammatory response. And it's becoming more like showing things like sore throat, changing your surfactant coding, having you more being thirsty, and so on and so on. Right. So how is this for warm-up? Good? Okay, so now we have 16 case studies that I will have you do it, and we'll have 15 minutes for each one. I think it's enough. If you want a shorter, we can go shorter. So you have 16 of them. And then when you finish all of them, then we're going to compare what you wrote. So we're not going to go one by one like this one. So I'll try to simulate like an exam, but instead of an hour for each, we're going to do 15 minutes, which I think you can do it in 15 minutes. Do we need more than 15 minutes for each course, for each case? I think 15 is okay. Yeah? Okay. Do you want a break before we go in it? Do you want to go for lunch and then come back and with sort of full belly and attack it? Yeah, let's do that then, if everyone is okay with that. Full lunch. So now it's 12:10. Let's be here at 1:10. Sounds good? I think it is. Is it on? Oh yeah. You guys had a good lunch? Hi. Uh-huh. Okay, so yes, hi. I believe so, yes. Yeah, I believe so, yes. Yeah, you can bring it with you. You can bring pretty much. Yeah, go ahead, go ahead.
The college, they send an email saying that the book
I believe you can bring those.
So you cannot bring your own notes. You cannot bring any electricity book, or you can bring any like binder, like paper book.
Yeah, you can print printed books, but no like phones or computers, and yeah, know your notes, right?
You can bring your own notes.
No notes.
How about you print them and write it in my book?
I don't know. Try it and then let us know. How did it go?
Yeah, because they say that the examination center, they have the final judgment. So I sent an email to the college, to the examination center, I write down all the name and on the offer, they didn't respond.
They very rarely respond to anyone, unfortunately. Yeah. It's, because they don't have too many people and there's lots of questions, so then, yeah, lots of people complain that they don't respond on time. So
So some people bring this up, no problem, right?
from what we heard, yes, they were allowed to bring them in.
Okay.
Yeah. Okay, so why don't we slowly grab the notes? So we're gonna do this first case study. So we're gonna give you a 15 minutes, and then you're gonna do this case study. So as you see, the first page has the information. One second. So it starts with the headache, right? So it has all of the basic information that you need, and then on the second page, you need to actually do the work. So you need to define the illness, which is here easy. It's a headache, right? He actually tells you. Syndrome, that's a little less easy. Treatment principle, then, explanation. Treatment plan for you who are acupuncturists, you just put acupuncture and then explain why, or you can put like that way. And for the herbology, like if anyone is TCM practitioner, you can add herbal formula as well. And after 15 minutes, I'm going to call the time. We're going to move to next scenario. So every 15 minutes, we're going to next scenario. So we have 16 scenarios, okay? So I think 15 minutes is quite enough. If it's not, let me know, right? You don't have a, you need to go see Alex so he can print it for you. Oh yeah, we can have a break anytime you want. So we can do first 4 if you want, and then have a break. Yeah. So you don't feel overwhelmed. Yeah. And in the end, we're gonna go through all of them. I'm gonna give you answers, right? Yes.
Do you think you'll go right until 5 today?
I don't know. Depends on you guys. That's fine. No, that's okay. Listen, if you have to leave, you have to leave. You know. No, it's okay. Listen, it's life. I understand. Yeah. So the first one is headache. So case study, headache. And so you'll have a first page is information, second page is like blank with, illness, the syndrome, the way he printed and gave it to you guys. I'm holding. That's okay. No. Okay. So, okay, just take your time, and then when you guys ready, let's give you like a few minutes. You set up, and then we'll call it. Last time we did this, most of the people did it in under 10 minutes. Just headache. So you should read like this. A male 48-year-old main medical complaint of patient suffering from headache accompanied with feeling of cloudiness, heaviness, and dizziness. Now, these are not my notes. This is notes from the instructors that compiled it through teaching this course. And basically, I'm just administering to you guys. And then I'll show you later on the results, what they put it as a disease, illness, and everything. Well, listen, you're going to have time. Every time I open it, you'll have a minute or so to find it. So, and 50 minutes is a lose, just to give you a sense of not so much urgency, but that you do have a time constraint on it, right? Okay, so why don't we start now? So basically, we will stop at 1:35. So right now is 1:20. So in 15 minutes. So first case study, headache. Patient is male, 48 years old, main medical complaint, suffering from headache accompanied by fever, feeling of cloudiness, heaviness, and dizziness. Patient medical history, suffering for headache for 10 years, so chronic. Assessment information. One second. Man, this computer never works as it should. I always get some garbage computers here. Symptoms described by patient. Headache occurs around the forehead and is or were dull in character. They were accompanied by feeling of cloudiness, heaviness, and dizziness. He also suffered from extreme tiredness and lack of sexual drive. He felt cold easily. Information collected by you. Tongue is pale with swollen sides and very sticky yellow coating. Pulse is deep and slippery. The reason why I'm saying this out loud is so the guys online can hear it. I know you can read it. So first define the illness. Yes. Here, sorry. Yeah, no problem. I'm just trying to fight the computer. Here we go. Yes, what's the question? You have it there. That's yours. You're going to keep home. Oh, you want a next page? Yeah. Okay. How? Oh, okay. Sorry. How far? Yeah. Every case, it's kind of like exam. And then you'll see how you did it, because I'll show you answers later. So, you know, it makes, obviously, 15 minutes is not what you have when you're in a government exam. You're going to have an hour but, you know, I figure out this puts a little bit of pressure on you just so you know, like, how you do it. Exactly, because you start second-guessing yourself. So we have a male, 39 years old. Main complaint is suffering from tinnitus for 11 years. Also suffers from lower backache, dizziness, a slight loss of hearing, and slight impotence with occasional discharge of mucus-like substance from penis. So, patient also shares with you that suffers tinnitus from previous 11 years. Tinnitus started gradually, and he said it sounded like jet engine. So that's interesting. There's high and low pitch tinnitus, right? He also suffers from lower back dizziness, slight loss of hearing, slight impotence, and discharge of mucus from penis. Information collected by you. Additional information here. He complains of diarrhea, problem that he has since teenage years. His stools are often mixed with some mucus. He sleeps badly, waking up frequently with a dry throat. He has some soft swelling under skin on the limbs, which has been diagnosed as ganglioneuromas. He also complains of constant mucus on his chest and dryness of mouth. So lots of mucus stuff, different parts in the body. Information collected by you. Tongue is slightly red, swollen with swollen sides of the spleen type. The coating was rootless, so that means easily picked up off the tongue, and missing in the places, so geographic tongue, as we call it. There was a deep hard crack on the tongue. Pulse feels fine on the right side, slightly slippery and full on the left, with the left front position of the heart very slightly overflowing, but empty and somewhat pointed in shape. So pretty detailed pulse. Yes. Okay, so we're gonna close this one. And we're going to the third one. So this one is epigastric pain. So we have a patient who's a female, 45 years old. Main complaint is suffering from epigastric pain accompanied by slight nausea and acidity. This epigastric pain is going on for the last 2 years. Pain is dull, worse lying down, aggravated by pressure on the area, and accompanied by slight nausea and acidity. So there's acid reflux. When pain was bad, she also became constipated and her appetite decreased. She also had a slight feeling of fullness. Fullness, I would say, in abdominal area. Besides this problem, she also experienced some slight bleeding in between period with light fresh blood for 4 months. So symptoms described by patient. pain was dull, worse lying down, aggravated by pressing on the area, accompanied by slight nausea and acidity. When pain was bad, she also had become constipated and her appetite decreased. She also had slight feeling of fullness in abdominal area. Besides this problem, she experienced some slight bleeding between the periods with light fresh blood for 4 months. Information collected by practitioner. Tongue is pale with slight bluish and purple tinge to it. There are bilateral teeth marks and sticky white coating, and pulse is slippery on the whole and weak on the right side. So this is the last one before we take a break. Okay, so this is a edema case. So we have female, 48 years old, suffering from edema of the lower legs, felt cold in general, but often had a burning feeling in her feet, suffering from edema of the lower legs from age of 15, and now she is 48, so quite a long time. She has been taking modiuretic, which is a diuretic medication, for the last 12 years. To recap, she feels cold in general, but often had burning feeling in her feet. Her urine was sometimes dark. She also suffers from lower back ache and loose stools. Information collected by you. Tongue is slightly red and stiff. Pulse is very fine and extremely weak on both rear positions, which are kidney positions. Okay. Let's do the answers. So first one was what? Headache, right? Okay, let's look at headache first. Oh, sorry. Opened the wrong one. Okay. First one was a headache. So it was male, 48 years old, right? Okay, so TCM diagnosis, it was headache, syndrome, turbid phlegm obstructing the head orifices secondaries to spleen-Yang deficiency. Turbid phlegm obstructing the head orifices secondary to spleen-Yang deficiency. Spleen-Yang, not kidney-Yang. Okay. Deficiency. Okay. Yeah, that's okay. So explanation here was that turbid phlegm obstructing, it was preventing clear Yang from rising into the head, right? I don't know how, actually. I tried to make it bigger, but I don't know how. Let me see, maybe here, one sec. Here we go. Now we're talking. Okay. So basically, there was a dizziness in particular, distinguished from dampness. The phlegm aroused from background of spleen-Yang deficiency, pale tongue with swollen sides, deep pulse, feeling cold, tiredness, and lack of sexual drive. So not kidney-Yang, but spleen-Yang. So as they say, right? Treatment principle, due chronicity of attention was directed to treatment both routine and manifestations simultaneously. This involved both tonifying body, qi, eliminating pathogenic factor, in this case phlegm. Patient was treated with acupuncture only. Acupuncture here. Main point were REN 12, stomach 36, bladder 20, and spleen 3 to reinforce spleen-Yang. Moxa was used on stomach 36 to tonify it. Lung 7 and large intestine 4 were used to stimulate rising of clear Yang to the head and open the head orifices. Stomach 8 was main point for headache from phlegm of dampness. Stomach 40 was used with even method to resolve phlegm. I don't know. You got to ask Alex, right? I'll ask him.
Yeah. Thank you so much.
Alex. Alex is not there yet, so I have no idea what to tell you guys. When he comes, I'll ask him. Okay, so let's look at the second one. So second one was tinnitus, right? Okay. So TCM diagnosed tinnitus, we know that. Syndrome, phlegm obstruction, head orifices, secondary to spleen, Qi deficiency, and kidney yin deficiency. Let's make it up. So you want it bigger, right? Bigger picture. Okay. Oh, here's Alex, I think. Let's just ask him. Ah, that's you. I thought it's Alex. I thought it's Alex. Okay. We're just showing them the results. Illness was tinnitus, yeah. Yep. Phlegm obstructing head orifice, secondary to spleen, Qi deficiency, and kidney yin deficiency. So treatment principle here: tonify spleen, resolve phlegm, nourish kidney yin, and calm the mind. Treatment plan are these points. Sorry? That's why calm the mind. Because the kidney yin anchors the mind. You have a central crack. Yeah, that's usually points to heart yin deficiency as well. But the root is in kidney yin. In this case, yes. It usually indicates heart yin deficiency. Like a fissure, almost like someone sliced the tongue, right? But it's deep. Usually, it's a bit wider. It's a bit wider fissure, so that means it existed for a longer period of time. You could put it also as well there. The more, the merrier. But then you need more explanations and more points. Remember, you add more syndromes, you're showing off. You're showing off. You better back it up. So my suggestion to you is, don't go too conservative, but don't go crazy, because you need to write more. So keep it consistent, like that they know that you know, but you don't, it's not like about showing that you have PhD in the knowledge, but it's enough to show them that you know your stuff, that there is a reason why you're practicing this. So don't go overboard, basically, right? Okay. So kidney deficiency, insomnia. Well, here they're implicating the heart, right? But then also there's certain deficiency of heart qi from emotional problems, obviously dating back to childhood, teenage years. One can tell this from heart crack on the tongue, but I believe it's more than heart qi. It's heart yin. Let me just Alex for these things. Alex, I think they want also hold answers. Yeah. I don't know. What's easier for you? Yeah. Okay. You have it, answers? Okay, but okay, you copy on your computer. Let me just show them the last answer, and then we're gonna go on a break, and I'll give it to you. Okay. Good. Yeah, he's gonna make a copy for you guys. Okay. Okay, so you don't have to worry about this. Okay, epigastric pain. That was no edema. Which one was it? It was epigastric pain, then edema. Yeah. Okay. Okay. So let's have a look. So epigastric pain was illness. And spleen and stomach chi deficiency causing food retention with chronic blood stasis is syndrome. It's here. So this is tough one because it's mixed deficiency and excess. This is real life, guys. That's how most of people show it to you. When they present in your clinic, they mixture of excess and deficiency. No one is just excess and no one is just deficiency. You always have both. Question is which one is stronger? Who's leading the show, right? So this mimics the real life. So treatment principle here is to tonify spleen, qi, resolve retention of food, right? They say it was not necessary to deal with blood directly, or stasis of the blood, as this should resolve if you tonify spleen, qi enough, right? Treatment plan, acupuncture here. Alex is going to give it to you, so you don't have to copy. Herbal treatment here is Baucher 1. Yeah, they give it to you, so you don't have to save the memory. Okay, so let's have a look at the last one, which was edema, right? So kidney yang and kidney yin deficiency. Yeah, you could argue that but it was like if you looked at, you can get a diarrhea from kidney yang deficiency as well. Yeah. But you have also element of kidney yin deficiency as well. So treatment acupuncture is to support mostly yang, but also yin.
I said cold damping day between not controlling the blood. That's way, like, that's not there, right?
No. That would disqualify you. Yeah. They would say, okay, she's playing with it, but nowhere close to it. You are in Toronto, but nowhere in a near vicinity of the part of Toronto you need to be. Yeah, that's why their rule. Remember, 3/4 of the signs and symptoms should fit in your syndrome, and if you can't, you gotta add extra syndrome to sort of fit it together. And you gotta watch that one syndrome leads to another pathologically. It's not like just you like them, so you put them together. No, one leads pathologically to another, right? Okay, that's it for now. Let's have a break, and then we'll come back to it. Sorry? Yeah, I just showed you.
Oh, well, that's why, because I was still talking about Diagnostic.
Sorry.
No, that's not what I put for edema.
Sorry?
Never mind.
Okay.
That wasn't what I put for edema.
Okay. So, 10 minutes break, 5 minutes break, how long you want it? 10? Okay, so like in 10 minutes we're going to start again.
Yeah. I had, what?
Okay, let me just give him this stuff. Here it is. Sorry, Alex, I'm making you work too much today. Okay, so we're starting with constipation. Okay, so we have a female or little girl, age 4, emaciated, abdominal pain and distension, constipation for more than a month. I don't know what kind of working distress a 4-year-old has, but I think so. It should probably be 24 or 40. Yeah, yeah. I don't think it's 4. Like, who works at 4? I mean,
I have a patient 4 years old.
no, but who works at 4 years old? It's due to working distress. No 4-year-old doesn't work. So maybe 40. Yeah. Yeah, I think it's a typo. This month, experienced chest and hypochondriac pain, anorexia, frequent burping, situation was relieved after she used this herbal formula, right? Um, um, Basically, so we have constipation still exists, abdominal distension and pain remain while discharging intended to while she's trying to discharge but failed to discharge any stool. So problem with motility, obviously. She was passing wind a lot before the dry stool was discharged forcefully. Sometimes the stool was first dry, then loose. There's a bitter taste in the mouth. Oh. Um, yeah. So this is constipation one. Information collected by you. The tongue is pale red with the red margins, thin white and greasy coating, and pulse is wiry and slippery. Right. So it is a bit complex. So yeah, I believe it's a 40-year-old, not 4-year-old. Yeah. Yeah, a little typo issues. Okay, why don't we start? Um, he left? What's his name? He left? Yeah. I think he left, right? Oh, okay. Okay. If he waited for a bit, he would get all the case scenarios. He's just finishing it now. He didn't get the sheets with answers. If you wait a few minutes, he's just finishing the printing. Okay. Sure.
My question,
Yes.
it's possible that like we'll practice so many, just check see which read is efficient or excellent, right? We cannot do
No, this is a written exam. It's not a practical, right?
yeah written exam still should go by and actually which reading your work.
Probably. To be honest, I have no idea how they even arrange this exam. So yeah, so you got to take it up with them. I don't.
I know.
It's like
just wonder,
yeah.
Whether we can write the way we are doing,
No,
right? All
no.
the time.
And it will not be easy for next 5 to 10 years till they sort of solidify as a college. But I'm thinking regulatory college as well, right? Every profession goes through this. First 5, 10 years, it's a wild west. It's crazy. And then profession settles, right? And then it's easier and things are more sort of logical. Yeah. Yeah. True. Yeah. 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 It's every profession pretty much has that. Oh yeah. Yeah. I mean, massage is pretty big as a profession considering like there's about 10,000, almost 12 now, 1,000 members. So you would think that actually things will go down. I think we're fifth profession size-wise. Physicians are largest, then nurses, or other way around. I'm not sure. Then I'm not sure who else is then. Maybe dentist or one of those. I know we're at fourth or fifth. We used to be. Chiropractors have what, 7, 8,000, somewhere there, right? Yeah. You guys have even more if you have more schools, right? Because there are only 2 schools in Canada, French one and this one in Toronto. Plus, you have lots of people from who go here for U.S. to study, right, and then come back. Yeah. Finger Lakes. Yeah, yeah, just across. Yeah. 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 Is it more expensive? Yeah. 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 No, I live there, and it's very tough. Like I don't work there; I just live. But I know a number of people who work there, and they told me every day is tougher and tougher. No. Yeah. But those people not necessarily have all benefits, and most of them work in okay jobs, but their benefits are being squeezed out. That means they come less and less. Doesn't matter they're wealthy. Most of these people will not pay out of pocket. They, yeah. 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 I find it of the largest group of population that it's very liberal with using benefits were always teachers. So it's female-driven profession, and they used to have all great benefits. Not anymore. More and more, like this teacher board is squeezing, that one is squeezing. Like they're going from, like 500 for each to 1,000, all of it. Take whatever you want. Yeah, it's rough one. And of course, the MVA is just being like totally like dried out. You guys still have it okay, chiropractors, because you can bill okay. But I mean, most of us, nothing. We can't even authorize our own plans, so we're like slaves there. Yeah. Huge. Yeah. Yeah. And you would think with that HCI electronically it would be less. It's actually more now. Yeah. Whole point of that HCI was to lessen the paperwork, so to be more streamlined. But, yeah. Yeah. There are some nice places in Ontario you can land. Oh. High, yeah, rent real estate, but that's the highest crime rate in Canada, in Kelowna. You would never tell, right? Yeah. My cousin is RCMP, so so we talked a few times. He says they have probably one of the best climates in Canada, Kelowna, Okanagan Valley, highest crime rate. I said, how come? I would say Toronto or Vancouver. He says because not industry, but lots of drugs. Like they have farms with the drugs. What's it called? Motorcycle gangs, stuff like this. Close proximity to U.S. So it's yeah. But from outside, it doesn't look like that. It's a nightmare. Yeah. Yeah. But the best place to live climate-wise in Canada, because it's a semi-arid, semi-dry. Yeah. 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 He was posted there for 3 years, but he said when the fire starts, you better jump in the lake because there's nowhere to escape. And every summer they have fire. And like code calls for you to have first tree 50 meters from the home, but no one does that. They just cut enough trees to put the house because of the shade. And of course, those pines, they just burn, and your house is like in 15 minutes gone. And not yours, everyone else, because it's dry. Well, especially now after, yeah, yeah. Well, now after Alberta, I don't think insurance is going to cover fire. Much. What was it? $3-something billion. Ugh, would bankrupt them. It's kind of like floods, you know. After a few floods, they just said, no, we're not covering anymore. Yeah. Georgetown, Dundas, even Guelph would be good. Guelph is interesting. Yeah, yeah. Somewhere in escarpment, like Watertown, somewhere there. Still growing, but not fat big enough. Georgetown, maybe Bolton. Where's the Bolton? That, yeah, that's like Oxbridge. Oxbridge used to do that. Like you couldn't buy the real estate; they bought it between themselves first, so no one can come in. Yeah, yeah. Lots of people says it's a nice place for now, like everything else. Yeah. Sure. Well, or English, like after UK, lots of now UK residents are coming to Canada. They started already. They say that Canadian embassy is swamped over there in London. How many people are like applying to come? Well, they see us as a colony still, right? Yeah. 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 You know, the Saudis who own all those rich real estate holdings in London, they're dumping them. They're selling it. Yeah, and Saudis have a lot of it. Apparently, $6 billion worth of it. Like some of the top ones in London, they're selling like crazy. But it's not English. English are not buying. You know who's buying it? No, you're gonna laugh. Russians, of all people, they're looking to have a war with Russians, and Russians are buying everything in London. So if you don't win with the rockets, we're already there, right? So, anyway, let's go to next one. So coughing is the next one. 42-year-old, yes, worker. He has coughing intensified for 3 days. Sickness started 1 month ago for a few days and was intensified last 3 days. Coughing, aversion to cold. He had a fever and shivering, little sweat, stuffy nose, sore throat, chest pain while coughing. Phlegm was white and sticky, containing bubbles, sometimes mixed with the yellow and thick lumps. That's interesting. Thirsty but not willing to drink. Bowel movements once on every other day, I guess. No improvement, even after taking oral pills or after injection of penicillin. So, like basically after antibiotics, fast-acting one, when you inject them, no improvement. Body temperature is 38 with 5, so basically borderline for what we would call they have a fever, right? Diagnosis hearing. Oh, I mean, I guess through stethoscope, looking from bronchi, right? Found no pathological changes. Tongue condition is pale tongue with a thin white coat. Pulse condition floating and slippery. Interesting. So it's definitely illness is cough, right? We know that. Just got to figure out the symptoms. So patient is male, 36 years old, married, lost some weight, 5 kilos, has number of the symptoms that point to to diabetes, right? Thirst, uh, frequent urination. It's admitted to hospital for half a month because of these diabetic symptoms, which lasted for last 3 years. He has a family history of diabetes. Symptoms currently are emaciated, dry mouth, thirst, desire to drink, lost about 5 kilos, flustered, lots of spontaneous perspiration, again, thirst and too much urination, lassitude and deficiency, information collected by practitioner, dark pale tongue with white coating, deep wiry and rapid pulse, and there is some lab tests also pointing to history of diabetes. So if you look to wiry and rapid pulse, dark pale tongue with white coating. I don't know how you can have dark and pale tongue, so it's a little misnomer there, but yeah. As I mentioned, unfortunately, I didn't do a spell check on this. This is given to me to teach. This is collected by colleagues, so I'm just a mouthpiece here. Don't throw tomatoes at me. Or apples, God forbid. That's harder. So we know disease here is diabetes. Shaka. Sorry, so basically it's small wasting, I think, translated from Chinese, right? But then we got to figure out the syndrome.
What's the urine glucose 4 plus for them?
So these are lab tests down there for urine glucose, basically 4 times more in the urine means that, yeah, 4 times more, right? Nah, you don't look that old. I think you're a tough guy. You can do it. I wish we looked like you when we were your age. You're Gucci. How's your son doing?
All right. He don't need a write exam. Missioner. Don't need a write.
Really?
Yeah.
Oh, because of diploma. Okay.
What?
Yeah, because he's diploma, right? Where is he practicing?
With me.
Okay, cool. I was not sure.
Huh?
I didn't know if he practiced with you or separate some. Okay. Good guy.
You know, when you graduate from missioner, who want to come see you? That's the bottom line, right? See, I have patients from all over the world. So, you see all kinds of problems.
Good for him. Yeah, that's good. That's good.
I think young people, no one have this experience.
True.
Almost see, just cancer patient, eh? Hey, listen, see 20 different kind of cancer. And you know how to do it. I get all the autoimmune system problem almost every time.
Sounds good.
Not just see.
Pass my regards to him.
Hmm?
Pass my regards to him. He knows who I am.
Because of that opportunity.
Yeah. Yeah. Yeah, that's good.
Normal people, they when they in the mission at that time I know, the whole day waiting for patients.
When I was there, it was a bit better because I was the last group. We had actually busy clinic by that time, but it was already 7 years in existence, so the clinic was by that time busy, and we moved more into hospitals. So I was more in a hospital, Mount Sinai and St. John's Rehab Hospital. So I worked in St. John's Rehab Hospital, so it's a bit busier, but yeah. But when the school started, it was slow. Yeah, he was in one of the first, right? Second year, yeah.
asking first time.
Sorry, what's the answer for this one? Yeah. No problem. Yeah, I'm going to show you answers in a few minutes. Okay, thanks for coming. Okay. Yeah, thank you guys, and I'm sure you're going to do excellent. So. Sure, absolutely. Yeah, absolutely. Yeah, absolutely. Yeah, no problem. Bye-bye. Yeah, absolutely. No, thank you, and good luck with everything, and I'm sure. I am teaching all year round here. Yeah, so I'll be here. Yeah, no problem. Okay, thanks for coming. Bye-bye. Okay, let's look at the next scenario. Sure. Do you want me to go just to answers directly, and then we can look at, just show you the first page, and then we can figure out the answers, kind of like first aid? Yeah. We can probably do that way, just to speed up things. Okay, so let's look coughing first. Yeah. So coughing, so we did coughing. Oh, sorry. Yeah, instead 40. Okay, let's do then that one. Yeah. Sorry. So constipation, it is. Yeah. Okay. So we have a diagnosis: constipation, syndrome differentiation, liver qi stagnation, and spleen qi deficiency. There's qi missing here. It's a spleen deficiency. It's qi deficiency. So TCM diagnosis: illness is constipation, right? Syndrome differentiation is liver qi stagnation and spleen qi deficiency. Reason for a diagnosis: basically emotional disorder that triggers liver qi stagnation, right? Which then invades the spleen and it causes the sort of constipation, right? So treatment principle is regulating liver and spleen qi and moving stagnation. So acupuncture points here are, front move point for the large intestine, stomach 25, Sanjiao 6, right? Stomach 28, stomach 29, stomach 40, liver 3, and Ren 12, right? Herbal prescription is modified Liu Mo Tang. It's a constipation formula, right? Okay, let's look at the next one. So the next one was, what was the next one? Next one was coughing, was it? Yeah, okay. Okay, so we have TCM diagnosis: coughing, syndrome differentiation, wind cold invading lung, obstructing trachea. So it was wind cold, right? Treatment principle: dispelling wind and resolving the phlegm, ventilating lung, and relieving cough. Treatment plan was lung 7, large intestine 4, bladder 12, lung 9, bladder 13. And the formula here is modify Shishentang plus Zitrozan. So it's a combination of two formulas. One was for removing the wind cold, another one was to degrade the phlegm that was causing obstruction, right? So one was dispersing, another one was sort of blocking the qi from going down, being a phlegm. So we used the two herbal formulas to deal with that, because one wouldn't do it. Okay. Next one was diabetes, right? The diabetes? Okay. So we have 36-year-old diabetes. So illness is diabetes, of course. Syndrome differentiation, deficient qi and yin, dryness, heat, injuring the fluid. Mm-hmm. Oh. Sure, sure. So acupuncture treatment here is sort of tonifying the qi and nourishing the yin. So basically, in this essence, tonifying the yin as well. So we have an extra point, Wei Wan Xian Shu. We have Fei Shu, the back shu point for liver, for spleen, for kidney, right? Bladder 13, 20, and 23. Spleen 6, kidney 3, kidney 7, do 4, do 3, right? And the formula here is modify Shen Mai San and Zheng Ye Tang. Sorry? Yeah, do 3 and 4. Oh, sorry. I apologize. Yeah. It is. Yeah, Guanyan. Yeah, it is. Yeah. It's a. No, it's not. It's a do 4 and Ren 3. Yeah, sorry. Okay. Let's look at the next one. So we're gonna look at diarrhea. So we're gonna just go through the protocol and then we're gonna look at the disease. So chief complaint here, we have female 42-year-old patient who has diarrhea during menstruation. Patient bowel moved to regular, so once a day, except that during her menstrual period she suffers from loose or even watery bowel movements. Symptoms presented by her are thirst with need for drinking, urgent urination, insomnia with vivid dreams, perceived heaviness sensation of bilateral legs, profused menstruation with the blood clots. Tongue is a red tongue with white coating, pulse is wiry and fine. So diagnosis is diarrhea during the menstruation. Syndrome differentiation here is kidney yin deficiency causing internal damp heat. So treatment principle are nourishing the kidney yin and clearing the damp heat in large intestine. Right. Treatment protocol are stomach 25, so front move point for large intestine, stomach 37, spleen 9, Ren 9, stomach 44, stomach 36, and spleen 4. The herbal formula is modified Tongxie Yaofang, which is the formula for diarrhea with abdominal pain or blood stagnation. Mm-hmm. Sure, it's up to you guys. This is your time. Whatever you guys want. You're the boss. Okay. So what I would suggest is try, make yourself one of those pages, like just print one and make copies and go through it and test yourself. So don't purposely look for it. Just do it the way you want it, of course, and then look it after, see how close you are to it. Why? What's your thought? Like based on the information they gave you. So that way, it gives you sort of drill, but it gives you that thing, you go first illness, then syndrome, then treatment principle, then treatment itself, acupuncture, lifestyle counseling, whatever. So you follow always the format. And then when you do it, then you can go back once you do all three and then plug in more stuff, right? But my suggestion would be go, do all three, then come back and fix things a bit more, firm it up and stuff. Don't stick with one because it'll eat your time, right? Usually first one just sucks your time. And then you look, and then you're in panic mode because you realize you don't have much time. So just go through it, flow it. And, and then later on go back and fix it. Like, that's what I would do. If they don't allow you to go back, then obviously you got to do case by case, right? Yeah, that's what we heard.